Please come to order. Good morning. Welcome to the Commissioner of St. Mary's County meeting this date, Tuesday, September 28, 2021. I am Randy Guy, President of the Commissioner of St. Mary's County. I'd like to introduce the other commissioners. Sitting to my right, representing the 1st Commissioner District, which includes Ridge, Piney Point, St. George's Island, Mr. Eric Colvin.
Good morning.
Representing the 2nd Commissioner District, which includes Leonardtown, Hollywood, Mr. Mike Hewitt.
Good morning.
Sitting to my left, representing the 3rd Commissioner District, which includes Charlotte Hall, 7th District, Golden Beach, and Mechanicsville, Mr. John O'Connor.
Good morning.
Representing the 4th Commissioner District, which includes Lexington Park, some of California, Great Mills, and some of Hollywood, Mr. Todd Morgan. Dr. Rebecca Bridget, our County Administrator, is sitting at the table to my left.
Good morning.
Lisa Cassis, our Communications Director, is sitting at the table to my right.
Morning.
Amy Carter, our video media producer, is behind the glass. Please turn your cell phones off or on vibrate. When you come to the presenter's table, please come down the center aisle. And remember, this meeting is being televised, so you need to speak clearly and directly into the microphone for recording purposes. At this time, we'll have the invocation of pledge by Commissioner Morgan. Please stand.
Dear Heavenly Father, guide us in our decisions, strengthen us in our resolve. Allow us to serve the needs of our citizens. All this we ask in your name. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Morgan. Please be seated. At this time, we have a proclamation for World Architect Day by Commissioner Morgan.
Mr. President, if I could approve the consent agenda.
I'm sorry about that.
No
Need to
problem.
approve the consent agenda?
I move to approve the consent agenda, which includes the minutes of September 21st, 2021 as presented.
Second.
All those in favor? Aye. Any disapproval? Ayes have it. Next, we have the proclamation from Commissioner Morgan.
Thank you, Mr. Dietrich. Whereas, in 1985, the International Union of Architects established the first Monday of October as World Architecture Day to celebrate the contributions that architects make in providing modern, energy-efficient, safe, code-compliant, and aesthetically pleasing infrastructure for the public. And whereas the county appreciates the challenges of meeting complex building program requirements, current building codes, modern construction methods, and changing construction labor and material market prices. Now, therefore, we, the Commissioners of St. Mary's County, do hereby proclaim Monday, October 4th, 2021, World Architecture Day in St. Mary's County and encourage our citizens to explore and learn about architecture and pay tribute to those who create these beautiful and inspirational works. Thank you.
Well, so last year we had, we talked about, get the right side up here, FDR, Leonardtown Library. These are, this one's, we're going to open the bids on the new project, so this one's done. The Leonardtown Library and Garvey Senior Activity Center, complete functioning. We'll be doing Citizens Academy there tonight. The regional airport will always have work going on there, but the work that we talked about last year is done. Pax Park, that work is wrapping up, and really proud of that. It's beautiful. If you get a chance, take a drive through the neighborhood. Alan Settle just did a phenomenal job on that. The District 4 Sheriff's Outpost in Lexington Park, all done, operating, looks great, beautiful addition to the community, thanks to the architecture and, of course, the adult detention and rehabilitation center. That work goes on, but the actual addition is complete. And but this year we have new buildings to report. The animal shelter, well underway to completion of the exterior. That'll be opening next year in early fall, late summer. The North Farm Market, again, well underway. The siding's up. It looks like a building, and that'll be functional in the fall. In other words, very soon. The Sheriff's District 3 completed. So a lot of this is all due to, we have project managers who work with the architects, but the architects bringing the needs of the citizens and what the commissioners would like to have done to life and in a building, bricks and mortar, great stuff. So I'd just like to personally thank them and many of them for listening in today.
I would need to please stand for a photo op here now. Thank you. Next, we have a commendation. It's always great to see someone who spends over 30 years working for the county government. We must be doing something right to maintain that kind of loyalty through this time. So I'd like for Mr. Paul Reed to please come forward. Commissioner of St. Mary's County officially commends Paul Reed Jr. for 31 years, 3 months of outstanding, praiseworthy, and dedicated service with St. Mary's County government. Through your diligence, dedication, and relentless pursuit of excellence, you have rightfully earned the community's gratitude, respect, and admiration. We hereby express our sincere congratulations on this occasion of your retirement and extend best wishes for your future endeavors and ask God's blessing upon you. This date, October 1st, 2021. Thank you very much.
I may.
May.
Would you mind using the microphone, please?
Yes, ma'am.
Thank you very much.
Mr. Reed has, as noted, has been with us for many decades. And we're losing a valuable asset. A very skilled operator. He knows the community. He knows the needs of the community. Mr. Reed has sacrificed much of his time during significant weather events, snowstorms, hurricanes. I want to thank his family and his friends as well, for offering him to the citizens. When we get into these snowstorms, it's sometimes days on end, and he's been with us through thick and thin. And Paul, we're going to miss you.
We'll miss you guys too.
We're going to miss your jovial self. Don't hide. Please come back. During the Christmas party and so forth, and don't be a stranger.
Okay,
Okay. Thank you. On behalf of all your coworkers, thank you.
thanks.
Thank you, Mr. Tarr, for your time.
I just echo Rick's comments, and I've had, contact with Paul out in the field, rain, snow. He's one of the key people that's helped get the things done. Mm-hmm. And I thank you, Paul, and just wish you many happy years of retirement and enjoyable living.
It's been my
Thanks.
pleasure.
Thank you.
Thanks for blessing us with you being here.
Very good.
Paul, you have any comments you'd like to make? There's your time to speak.
I just want to say that I want to thank the county for giving me the opportunity to work for the Department of Public Works. We take great pride in taking care of the roads and stuff to make it safe for the community. And I just want to say thank you. I made a lot of friends along the way. So I just want to say thanks.
Well, we're going to miss you, and we thank you for all your time. Roads are important.
Yes, they
People
are.
got to get to work. They got to get emergencies and everything, and all this is definitely a part of our service to the community. Thank you very much.
You're welcome.
Picture. Yeah, come on up. Tar, come up. Tar, you stay right here. Stay right here. We're in a joint picture here. There we go. Thank you. Oh, one more. Okay. Thank you all very much again. Okay, next we're going to have a public hearing and good time. We will now open a public hearing on the repeal of the solar moratorium ordinance. Mr. David Weiskopf, the county attorney, will give us a update and brief. You got it.
Morning, sir.
Morning, sir.
Just here, as you know, January 20th of last year, the commissioners approved a solar task force. In March, the commissioners, at the solar task force request, adopted a moratorium on large-scale solar projects. And then the solar task force completed their report in August of this year. And as a result of that, the commissioners wanted to move forward with repealing the large-scale moratorium on solar projects. And here we are today at the public hearing.
Okay. Well, then, Dr. Bridget will now provide the format for the public hearing and continue.
Thank you, Commissioner President Guy. Here are the guidelines for the Commissioners of St. Mary's County public hearing for the Office of the County Attorney, public hearing, repeal of the solar moratorium ordinance. If you wish to address the Commissioners via teleconference, please call 301-475-4200, extension 1234, to provide your name and address for the record. You will then be given an opportunity to speak to the Commissioners through the phone conference. All speakers who wish to address the Commissioners in person are asked to fill in the sign-up sheet located in the lobby of the Chesapeake Building. All speakers will be allotted 3 minutes to address the Commissioners. At the end of the 3 minutes, our Communications Director, Elisa Casas, will let you know that your time has expired. We ask that you respect the 3-minute time limit in order to give all those who wish to participate an opportunity to be heard. The public hearing is being televised live on St. Mary's County Government TV 95 and the county's YouTube channel. If you should miss any part of the hearing, it will re-air on Channel 95 this Friday, October 1st at 6:30 p.m. and will remain available for on-demand viewing on the St. Mary's County Government YouTube channel. Citizens were provided an opportunity to address the Commissioners via video submissions, but because we didn't receive any video submissions for the repeal of the solar ordinance, moratorium ordinance public hearing, we will now begin accepting comments for those who have signed up to speak in person. Sharon, do we have anyone signed up to speak in person? No.
Uh-oh, Sharon's trapped in.
You can't get out the door.
That's how we keep people here.
Have to get that looked at.
That's how we keep people in. Once you get in, we got you.
Sharon Ferris reports we don't have anyone signed up to speak in person, so we'll now begin accepting comments through our teleconferencing system. Ms. Casas, do we have anyone on the phone?
Good morning, Dr. Bridget. Good morning, Commissioners. It doesn't appear that we do. Let me check in with our teleconference line. Thank you. Good morning, Julie. This is Elisa Casas. I'm calling to see if we have any call-ins this morning on our teleconference line for the Commissioners of St. Mary's County public hearing for the Office of the County Attorney, repeal of solar moratorium ordinance.
We do not.
Thank you, Julie. Dr. Bridget, Commissioners, we have no calls on our teleconference line this morning for this public hearing.
Thank you, Ms. Casas. Please note that the public comment period will remain open for 7 days until close of business on October 5th, should the public wish to send an email to csmc@stmarysmd.com or U.S. Mail to Post Office Box 653, Leonardtown, Maryland 20650. Commissioner President Guy, this concludes our public hearing.
Thank you, Dr. Bridget. Anything else? Public hearing closed.
Thank you, Commissioner.
Thank you very much.
When's it scheduled for?
October 19th is the
October
decision. Thank you, sir.
Okay, next I need a motion to adjourn as the St. Mary's County and reconvene as the St. Mary's County Board of
I
Health.
move to adjourn as the Commissioners of St. Mary's County and reconvene as the St. Mary's County Board of Health.
Second.
Have first, second, all in favor? Aye. Any opposed? Ayes have it. And so I move that Dr. Brewster will come forward now and our health officer and give her presentation. Morning, Dr. Brewster.
Hi, good morning. I hope you all are doing well. You want to advance forward?
Thank you. Likewise.
Thank you.
You ready for the website, Dr. Brewster?
Actually, if you want to just go to the slides.
Okay, great.
And then
Thank
I'll
you.
talk first. Thank you. Commissioners, we continue to be in a very high transmission state, as I'll go through in a moment with some of our local data points. I did want to note that we have, as of yesterday, updated our COVID data dashboard. And if Ms. Casas could click on that. Yeah, great. So we did this for a few reasons. One, we were having trouble with loading since we were adding in lots of tables and charts into one web page. And we wanted to categorize the data a little bit easier for people. So here's a high-level look at some key data points that people like to check in on every day. And then if you scroll to the bottom of the page, then we actually, those four blue, actually, if you go up a little bit to where the four blue buttons were, right there. Then residents can click on any of those buttons, and it'll take you to subpages where there'll be some additional data charts and metrics that we've made available, including all the data charts that I'll be reviewing in our slide set today. If you click on cases, for example, I'll go through these in more detail, but just to kind of give you a picture of it. The stuff that's on this page is more related to the cases and including information about breakthrough cases and so forth. If you go to the bottom where the buttons are.
You're going fast. What page you on?
Yep. I'll go back to some of the actual charts in the slide set. If you click on vaccines, this is information about vaccination in our county population, similar to some of the charts that you've seen before. We've added in a metric about booster doses if you keep scrolling down. And if you go all the way down to the bottom, you get those highlights again. If you click on outcomes, outcomes covers things like hospitalizations, deaths, release from isolation, et cetera. And we did add in some new hospitalization charts, which I'll go through in the slide set in a moment. If you scroll down to the bottom, and congregate settings. Congregate settings right now just includes long-term care facilities, of which in St. Mary's County we have 3 designated long-term care facilities. We are developing some additional data charts for other settings, which we'll show on this webpage in the future. All right, if you want to click out of that and go back to the slide set, thank you, Ms. Casas. And I'll give you a look into the actual data numbers from some of those charts that were on the website. So these are new COVID cases by week and vaccination status. As you can see, last week, the number of total cases for St. Mary's County was 641. That's the highest we've been since this pandemic started. In fact, it's far greater than even the peak that we experienced back after the holidays in the beginning of 2021. This likely is reflecting a variety of factors, certainly the in-person school for a few weeks, and then also a variety of events that we've had and Labor Day holiday and so forth definitely contributed to the number of cases that we saw last week.
It doesn't include the county fair, though.
No, this would not reflect the county fair. That would be probably a week from now,
Okay,
where we would see the impact of the county fair. Not this week as much as the week after. This reflects the new case rate. We're continuing to surge. This is our new daily case rate. And as you can see, still trekking upward. A lot of this, of course, as you know, as we've talked about, is largely driven by cases in individuals who are unvaccinated, as I'll talk about in a moment and show in a moment. And so we see the age groups where we have lower vaccination rates experience higher numbers of cases or higher rates of cases. And so that specifically, we're seeing that in the 0 to 19, 20 to 39 age groups the most. This really shows, I think, us that the rates of new cases in those who are unvaccinated is far greater than the rate of new cases in those who are fully vaccinated. While we do see breakthrough cases, that is to be expected. No vaccine is 100%. We're also dealing with some level of waning immunity in some populations. And when you have high transmission in the community, you're naturally going to get more breakthrough cases, again, because the vaccines aren't 100% effective. But they are effective, they're strongly effective against severe illness, and they are very effective at preventing illness from COVID itself. So this still, again, the vaccine and getting vaccinated is the number one tool that we have right now to protect our whole community. While it may be an individual health decision, it's a decision that has far-reaching impact on everyone in this community. These are the COVID fatalities. Our fatalities in St. Mary's County residents continue to grow. I'll show in a moment some additional data on fatalities that we've now made available. This includes about 21 fatalities in the less than 70 age group. COVID hospitalizations, we are tracking those, of course. They've been significantly higher, the number of daily hospital beds used by St. Mary's County residents related to COVID in this surge than what we've seen for most of the pandemic. We are, of course, following this. Hopefully, a decline in hospitalizations will happen as more and more people get vaccinated, because we know that vaccinations are the most effective strategy we have right now at preventing severe illness from COVID-19.
Dr. Brewster, do you have any idea, recognizing the number of St. Mary's County, I would assume most of these people are at our MedStar hospital, plus or minus?
Possibly, yeah.
Do you have any idea how many people or how many hospitalizations at MedStar here compared to the other MedStar units throughout the system?
So we get reports from MedStar, St. Mary's Hospital. I don't have comparative data for the other hospitals in the MedStar system.
Thank you.
But I can certainly forward that question to Dr. Michaels.
Dr. Bruce, let me ask you, it doesn't make sense if you've had this big increase, why'd you have that drop of?
So we usually see, if you recall, there was a couple weeks where we were fairly stable, right around the time school was starting before we got into it. Hospitalizations tend to lag a few weeks behind the number of cases. So this is probably reflecting the way our cases were trending about a few weeks ago. And also this is from a week ago, 9/23 is the last ending date. So there's a lag in hospitalizations, typically a few weeks, behind the rise in cases.
Oh, okay, I get you. So what you're saying, probably the week before when it was 40, that could have been a result of Labor Day or something like that.
Or reflective of when we started to see that surge really tick up towards the end of August.
It just surprised me that we have this big increase and we had a drop in hospitalizations. That's all I'm saying. Thank you.
Yeah, hopefully more people are getting vaccinated now as well. We have seen an uptick in vaccine uptake.
Good.
And additionally, people getting boosted. And so, that would affect breakthrough hospitalizations as well, which I'll talk about in a moment. Actually, if you go to the next slide. Before I do that, though, just again, the metric of who's fully vaccinated by age group in our county for county residents. And we're still looking at, we have seen a slight uptick compared to the graphs I was showing you probably a couple months ago in terms of total percentage of population fully vaccinated. We have seen some improvement. About 55% of our total population is vaccinated, about 62% of all adults. And the number in minors is rising as well, where we have about almost 15% of minors now fully vaccinated. However, these are far lower than where we really would want to be. Obviously, we want to decrease the impact of this surge, and the best way to do that is to get people fully vaccinated and protected against COVID-19.
Dr. Brewster, tell me, when you say 55% of the county is vaccinated, I'm glad 55% is. I wish it was higher. But tell me, how's that compared to, say, to other counties? Are we
Sure. A lot of other counties in Maryland are have much higher vaccination rates.
Oh, really?
Yes.
Calvert and Charles?
I don't have the figure to date to Calvert. Charles is definitely higher. And several of the kind of the statewide averages are about 10, 15 percentage points higher than this.
Okay. Thank you.
We actually just had a conversation about this, and there was something that came out from Legit in reference to vaccinations, and they're finding that the more rural counties have a lower vaccination rate than the urban counties. They're just finding that there's higher vaccination rates, even if you take out their per capita, that point blank. That's just the way it is, whether it's messaging, whether it's ideals, whether it's ideology. So there was a big discussion about that and what the ramification is going to be on local government with, the other side of it, the insurance side. So it was interesting.
Yeah, I mean, there's a big economic cost. If you think of it, these hospitalizations are incredibly expensive to employers, to the county, to public tax dollars. When people are sick and are quarantining and they're out of work, that's very expensive on employers. And it's hard on our industries and our infrastructure that rely upon those employees to provide services here locally, including our healthcare industry, which is taking care of the people that are getting sick.
So related to that too, we know that President Biden put out his federal mandate, and within the last week or so, clearer guidance has come out locally on the base for timelines, so we'll probably see this number trend up a little.
Yeah, we've already started seeing some people come in more recently. They won't be reflected in this fully vaccinated column yet. It takes about 5 weeks if you get Pfizer, or 6 weeks if you get Moderna, to be reflected in the fully vaccinated group. About 2 weeks if you get Johnson & Johnson, since that's a single-dose vaccine. Yeah. Hospitalizations by vaccine status. And again, the data here reflects, we're current in our data up until about the 23rd of September. That's how we get the hospitalization data from the state. So that last column is the week of the 18th, and or the week, ending in the 18th, and you can again see trending over the past several weeks, including that last column, how the vast majority of hospitalizations are occurring in those who are not vaccinated. This is from the start of the pandemic, so cumulative hospitalizations, you can see by vaccine status and age group. Again, one of the new charts that we have on our data page. This is hospitalizations by age and vaccination status. As expected, the vast majority of hospitalizations are happening, and those who are 60 and older, or the older age groups, tend to have higher risk of hospitalization. But the constant through all of this that you can clearly see from this is, again, the vast majority of hospitalizations in non-vaccinated people. And those who are fully vaccinated, while there are some breakthrough hospitalizations, especially in that 60-plus age group, there's a far, far lower risk of getting hospitalized from COVID if you are vaccinated than if you are not vaccinated. This breaks down the breakthrough hospitalizations. So of those hospitalizations and those persons who are fully hospitalized, the vast majority of them are happening in that 60-plus age group, which is also why, as I'll describe in a moment, we're focusing on booster doses, especially in our seniors.
Do we have data on hospitalizations and underlying issues, obesity,
we do not have which chronic conditions these hospitalizations may have with it right now. That's something we're trying to look into, but the way we get the information doesn't have that complete picture for us at the local health department. The deaths by vaccination status, we have had, the vast majority of deaths also are happening in those who are not vaccinated. We have had a few deaths in fully vaccinated individuals. This again tends to slant towards much older age groups. And we suspect there may be some waning immunity in those age groups, and again, why we're encouraging individuals who are eligible now to get booster doses to go ahead and get their booster dose.
When you say death by age group, I had a friend who called me about, I didn't know the person who had passed, but the person who had passed was a friend. He was in his 60s. He had obesity issues. Would not get a vaccine, got it, and passed. And that's a terrible thing. But it just does not make any sense to me how people who are a little bit up in age, I'm included, got the booster. My wife's scheduled to get the booster tomorrow.
Hey, great.
But the point is that what do you think is the reasons why people will not get this? I mean, I'm sorry to ask you a philosophical question, but
sure.
what is the answer?
There's a variety of reasons. I think a lot of it has to do with information that's out there that people are paying attention to. It's a pandemic. It's a new virus. These are new vaccines. And while we've had the vaccines now for several months and we've got great data on them, we probably have some of the best safety data on these vaccines than we have on any vaccines because there's been so many people that have taken the vaccines and we've had months now to monitor them. There are some very strong beliefs and beliefs being perpetuated, especially on social media, and information being perpetuated on social media that's inaccurate and is not scientifically or medically true. And unfortunately, a lot of people are believing it and paying attention to it, and it's influencing what they believe and so forth. And that's why we want to be very clear. And I think the data is very clear and shows what is true, which is that vaccines are effective and that the vaccines are protecting people from serious illness. They're not 100%. They're not 100%. But they are the most effective strategy that we have. And at a time when we have a very contagious variant of COVID-19, and we've got very high transmission here locally, and we have people who are not eligible to get vaccine, the under 12s in particular, who are very vulnerable now to getting exposed to this virus. It becomes even more imperative, I think, for the rest of us who are age eligible to get vaccine, to get the right information, and to make that decision that will help protect not only us, but also protect our community.
I guess my point would be it's not about there's no accessibility to a vaccine. You're out there, fire department, health department, and secondly, there's plenty of supply. Is that true?
Yeah, so we have plenty of supply right now. We do expect that supply will become more difficult to come around in about a month. When the age group, we expect under 12 individuals or some group under 12 to get approved for vaccine in about a month. We expect that more and more will be coming to vaccine sites to get vaccine doses as employer mandates pan out. And so if people are thinking about getting vaccine, or if they have an employer mandate that has a timeline associated with them with it, I would encourage them to go get vaccine now, because it will be more difficult to get access to vaccine months or a few weeks from now when all these new groups will be coming to get vaccine.
Dr. Brewster, I think it's important, at least for me, to acknowledge, based on conversations we've had and policies I've seen and hearing some other briefings on insurance, reinsurance, workers' comp, that there's some things that, can be done that are not a mandate for incentives for people to get vaccinated. I do like the policy that the sheriff's office has. I've discussed that with you, where, you have the ADA section, you have the Civil Rights Act of 1964, where there's certain exemptions within that. But the option is, if you do not want to get vaccinated, then because of the high risk of transmission and the safeties that are there, you get tested. And it's a test that has to be done every week. I do think that is a practical solution to ensure that those that are in the most critical arena of governmental operations and continuity operations is something that should be done, point blank. I mean, it is a step to mitigate some of the risk versus mandating somebody getting the shot. It's steps that other governments have taken and has been very successful. I've seen the smaller governments, which can afford it with the ARP, provide incentives that are very significant for their employees to go ahead and choose, just everything I already laid out, or get the vaccination. So I do believe there's options to be discussed. I don't know how palatable they are, but I do think that there are a means to a ways to allow people to have a choice which within some of this, while keeping government operations and not having the significant spread that you are seeing.
Yeah, those are great points, and I certainly commend those leaders that have stepped forward and implemented policy effective at keeping their workforces safe and decreasing the cost and impact on their agencies or on their organizations because of those policies. I will say, testing is a great alternative when we're trying to control the spread of infection, because it allows us to identify cases early and hopefully isolate those cases and quarantine their close contacts so that we can try to limit the spread of infection in a community. Testing itself carries a significant cost when you're doing it for masses of people on a weekly or twice weekly even basis. And our health department, which is running the 2 main testing sites in the county, does not have the capacity to handle employer testing for large employers in this county on a weekly basis. We're so focused right now on making sure testing is available to all of the individuals who are symptomatic or are concerned about their exposure or have been close contacts. We're already getting hundreds and hundreds of people getting tested every day. And if you add on to that hundreds or thousands of people who are choosing weekly testing, that's going to overwhelm our ability as a public system to provide testing for this community. And the urgent cares, where you're already seeing several hours wait as people are lining up to get tests. There are options there, though, for employers to look at purchasing or contracting testing on site or purchasing test kits to send home with their employees. There's a cost associated with that to the employer if they're the ones bearing that cost.
Yeah, there's been a balance. I've seen that done where they're purchasing the tests or they're hiring a firm. And then some others say, well, you bear the burden of the cost of testing.
Sure.
One particular policy I saw recently says the employee will go on their own time. Actually, I think it was the city of Bowie, to be exact. It was 9 a.m. every Monday, 48 hours prior, and they have to provide that to Human Resources. On their time, on their dime, and because they choose not to participate. Now, Bowie had a very strong stance on where they went with this. I'm not a fan of their follow through on the end because of their loss of workforce that resulted in their policy. Mm-hmm. So there's a balance, but
sure.
Either way, I'm researching it. I'm looking. It's something that's in the forefront, and just based on conversations I've had with you, I want to acknowledge that.
Yeah.
There is some sort of mechanism, whether it fits here or not.
Right. Thank you. And, again, to be clear, the test is great for identifying infection, especially when it's asymptomatic or pre-symptomatic, and for controlling spread. But the test is not going to prevent that hospitalization if you actually get infected. The vaccine is what is strongly effective in preventing that hospitalization if you get infected. All right, let's move over to testing. And definitely some updates in testing since I last came before you. We have moved general PCR testing for COVID-19 from our main Leonardtown Health Department site over to the Hollywood Volunteer Fire Department, where we also run a vaccine clinic. We'll soon, in another week or two, be transitioning to daily vaccine clinics at the Hollywood Volunteer Fire Department. Right now, we're just doing Monday, Wednesday, Friday, and Saturdays, periodic Saturdays. But the testing is there every day, Monday through Friday, during these hours, similar to how it was at the Leonardtown office.
How are your numbers there?
Several hundred every day.
Good.
It's a lot of people getting tested. Obviously, with the numbers as high as they are in the community, there's a lot of close contacts. There's a lot of people who are symptomatic or asymptomatic exposed. We are very, very busy over there, and then also very busy at the hub as well, which is also offers drive-through testing in the Lexington Park community, and also offers for people who don't have cars, walk up, bicycle coming forward, you can get tested through that means. We still have rapid PCR testing, but we have now limited the rapid PCR testing. We were getting several hundred requests every day for about 40 tests that we can offer on a daily basis of rapid PCR. So now we've limited it back to critical first responders and healthcare workers and teachers. And so that rapid PCR testing would be available to them if they are symptomatic or if they are identified as a close contact through an actual case investigation. As long as the supply is available for that day, those appointments are available. Those are still being done at the Leonardtown office, so they don't get wrapped up in the lines for testing at either of the other two testing sites, but they have to be done by appointment. So if anybody qualifies based on their occupation and symptoms or exposure, they can call that number there for an appointment.
Dr. Brewster, a couple of questions, please. I was up at Hollywood yesterday, and I will sit there and say getting the booster was fast, efficient, and easy, so that was great. And there were like 40 or 50 cars waiting in line for testing.
Yeah.
Following on what Commissioner Hewitt asked a little while ago, I don't know if it's legal, can you ask the people Were you at the county fair when they're going to get the test?
Yeah, so just because we're moving people by so quickly, and we don't really have the setup to make hash marks on a piece of paper when people answer questions, and we're trying to keep things the most efficient in the testing line because we are getting several hundred a day, we're not asking that when people to come to testing, but when we have positives, we do ask that in the contact tracing process.
Okay, next, this is flu season coming along also.
Yes.
And so we have the vaccines going into people and the flu shots going into people. Is there a recommended amount of time between the two that you should adhere to?
Great, thank you for bringing that up. I know I raised it in a prior Board of Health meeting. I don't have it in these slides, but I'll make sure to include it next time as well. The flu vaccine and the COVID vaccine are actually approved for co-administration. So you could get it at the exact same time. We would just recommend that you get it in different arms. And if people want to wait between the two and get the vaccines in the same arm, that's fine. Then if you get your COVID vaccine first, I would recommend you give it a handful of days before you get the flu vaccine in that same arm. Otherwise, if you're fine getting it in different arms, you could, get it at the same time or go the same day. That's totally up to you. But yes, we are encouraging anybody 6 months and older to get their flu vaccine by the end of October.
Okay.
Okay.
Thank you. I have some updates on vaccine, primarily about booster doses, which we'll talk about in a moment. All ready for a boost. All right, so as you recall, when we were rolling out vaccines for the first time back in December 2020, we knew there was going to be the prospect of booster doses because we are in a pandemic. In a pandemic, we are dealing with a virus that is mutating rapidly and causing a variety of new strains and variants of concern that emerge. And we also know that certain populations, especially seniors, tend to not build as strong of an immune response, either to vaccines or even a natural infection. And so that is physiologically what happens in the body, that individuals in older age groups tend not to have as strong of an immune response, or their immunity begins to wane a little earlier than perhaps younger people. That happens, again, as I said, with all kinds of bacteria and viruses. With the COVID virus, because it's one where we're seeing all these new strains emerge, especially as we continue to have a surge in cases largely driven by those cases in unvaccinated individuals, we are seeing more and more of these virus strains emerge to be concerned about. With the Delta variant, which is highly contagious, high transmission of COVID in our community, and now several months out from when people got their initial vaccine series, and of course, especially in those older populations who we vaccinated first, and also the high-risk groups that tend to be more and more exposed to COVID. There's now recommendations for booster doses. So right now, our recommendations are as what I've listed here. I've talked about the first one before, which was those who are immune compromised. This is less of a booster dose, as much as another dose that you need to try to get to similar kinds of immunity levels that those who are not immunocompromised may have already gotten to. So anybody 12 and older who received either Moderna or Pfizer who has some level of immune compromise would be eligible to get a booster of that same vaccine at least 28 days after their second dose. The last three bulleted items here on the table are ones that were added in just at the end of this past week, and we've already started distributing booster doses to individuals in these three age groups, these three groups. The first is individuals who are 65 and older who received Pfizer with their second dose of Pfizer at least 6 months ago. So far, that's the one that's been approved. We're waiting on information about Moderna. I expect that news to come out probably in another few weeks, if not earlier. But for right now, it's just Pfizer recipients only who received their second dose 6 months or more ago that are age 65 and older, regardless of health conditions. Again, true, that's just the body's physiology. Those who are 65 and older tend to have waning immunity to things at some point in time. The next item or group eligible would be those 18 and older who were Pfizer recipients who received their second dose at least 6 months ago, and who have some kind of underlying health condition. This could be as simple as being overweight, because we have seen a variety of health conditions associated with a higher risk for more severe illness related to COVID-19. So if you have any of those underlying health conditions, including if you're just a little bit overweight, that might put you at greater risk for more severe illness. And if you were a Pfizer recipient who had their second dose 6 months or more ago and you're at least 18 years old, you can come in and get your booster dose. The last group are individuals who have higher exposure to COVID-19 by virtue of the setting that they're in, they live in or work in, or by virtue of their profession. And there's a variety of professions that would consider themselves higher risk because they're dealing with the public more, because they have more and more people coming into an indoor environment from all different parts of the public, because they're healthcare providers perhaps, or first responders, and they get up close to people a lot because they have to because of their jobs. And so for those groups that have higher risks due to their occupational setting or the setting that they live in, for example, and who are 18 and older, who are Pfizer recipients with their second dose at least 6 months ago, they are also now eligible for a booster dose.
Dr. Bruce, tell me, first off, Pfizer only. I mean, I got Pfizer.
Sure.
So I'm glad I got the booster. Does that mean I'm better or worse than the
So
other one?
Pfizer came out before Moderna by a few weeks, and so they've had more time now to accumulate data, because there's an amount of time that you need to accumulate data over to turn that in for emergency use
got it.
authorization.
So it's an FDA type of...
It's partly there's a standard of time that's needed over which to collect data before you can apply for an emergency use authorization.
I guess my point is it FDA...
Yes, this is all FDA emergency use authorized.
Okay.
All these groups.
Second one is when I went to get my booster, I had looked on your site and saw your criteria.
Mm-hmm.
And when I went to tell them what was wrong with me, she said, hey, I don't have to know that. Just tell me yes or no. So
Thank you for bringing that up. Yes. So to that question, which is what proof do people need to show at our vaccine site? If you're immune compromised and you're going based on that category of eligibility, there's a question on the registration for the vaccine that asks you if you have an immune compromising condition or are taking a medicine that affects your immune system. You have to have marked yes to that question in order for us to give you a booster dose based on that eligibility category. If you're eligible based on age, we ask for identification at the vaccine site, which helps tell us what your age is and confirm your age. If you're eligible because you're an adult with an underlying health condition, you just need to self-attest that you have some kind of underlying health condition. You do not need to provide proof of that underlying health condition or disclose what that condition is to the people who are giving the vaccine at our vaccine site. Similarly, if you're 18 and older and you have an underlying high-risk occupation, or you feel like you're in a high-risk setting, or that you're in an occupation that gives you higher risk of exposure to COVID, again, that's just based on you identifying that you're higher risk. We are not asking for documentation at the vaccine site of certain occupations and so forth, like we did when we rolled out the vaccine, when we had limited supply, and we were picking and choosing which occupations and which groups and so forth. At this point in time, we're not doing that. Right now, we're focused on getting people easiest access, and the individual can determine if they meet these criteria, and if they self-attest that they do, at the vaccine site, we'll provide that booster dose.
Okay, my last question, you talked about overweight. Now, I remember, back in college days, it was always a freshman 15.
Sure.
Now it's a COVID-19. People working from home, it's so much easier to maybe put on a little bit extra weight. So when you say people who are overweight, is there do you have to look obese?
Yeah, so there's
or-
body mass index. So I don't know if you recall from when we were rolling out the vaccine originally, we held
Yeah, you
those
had that
BMI days at the Hollywood where we had people come in and, weigh themselves, and there's a chart where you can go from your weight and height. If you're associated with the military, this probably happens on a regular basis anyways. All of that's on the CDC website, on our health department website. If you just Google BMI, body mass index, there's a chart where you can put in your weight and your height, and it'll tell you what your BMI is.
Gotcha.
So if you're
So is that the criteria for getting the booster?
So if you are overweight is actually a medical term, as well as something that we use in our general language. But overweight is when your BMI is at a certain level or above. And then obesity is at an
At
even higher
20%
level,
or
25. Yeah, there's a certain number. So if you look on those charts, 25 or above is at the overweight category.
I'm sorry to be so
okay.
persistent, but if someone's anorexic, they're going to say, hey, I'm 3 pounds over, I'm overweight. Is there some kind of a number that they have to have in mind?
Yeah, so those BMI charts have those numbers. You put in your weight and you put in your height, and
Okay.
it'll spit out a number for
So
you.
if someone asks, just tell them to check their BMI chart.
Yes.
Yes.
All right.
Quite
Or talk
frank-
to their doctor.
It's
Quite
also
frankly-
by age, too, and it's by age and also the BMI chart.
BMI charts for adults or just for adults, there are recommended
I think there's an age thing in there, too.
categories for body fat percentage, and by pediatric, like younger age groups, we go by percentiles for BMI, not by those charts that adults typically work with.
You know, quite frankly, look at those BMI charts. They've been downgrading them. I mean, I'm like a whale coming with those charts. I mean, I think my average weight is to 185 to 222 at 6'6". So therefore, everyone my size is obese. So therefore, they can all go get a shot. So I wouldn't trust that BMI chart.
Well, the BMI charts were originally made decades ago based on tens of thousands of people in a variety of studies which looked at risks of health conditions, such as heart attack and so forth, related to height and weight. So the validity of those charts comes by looking at their risks of a variety of these kind of health events. It was largely done in residents who were white, and it was largely done in residents of certain age groups and so forth. And so there certainly, there may be, you can interpret it either way. The fact of the matter, though, is that those numbers correlate to certain risks, whether or not somebody, subjectively feels like they're overweight or not.
So the main thing, people need to call 301-475-4330 to register to get their booster shot.
No, actually, we prefer that you go to the website, otherwise our call center will get overwhelmed.
Don't call.
If you need help registering, we will help you over the phone. They can call the health
Go to
department.
the website and register. Okay.
Yes, but ideally, if people are able to register over the website, that would be great. We're already getting tons of calls to our COVID call center, and we'd love to keep the calls open and available,
Those that don't
especially to
have a
people who
computer
don't.
or can't do it, there's any
exactly.
number they need to call, they
Yeah,
can't use a
they
computer.
can call our health department. We'll help them get
Okay,
registered.
good enough. Thank
Yeah,
you.
no problem. We'll do that over the phone for them. Next. Thank you. Again, at our vaccine site right now, Monday, Wednesday, Friday, and certain Saturdays, I think this Saturday, we have some appointments available. They're going fast. So if people are trying to schedule in their first doses or their booster doses, please go on now to schedule that out. I think we're already booked out for Friday and tomorrow. And we will have some days for the following week as well that we'll announce shortly. And as Commissioner Guy pointed out, the phone number is there as well. We certainly would encourage people to go to the website first if they're able to go ahead and register for their booster dose. If you go to the next page, thank you. I did want to touch on a couple items related to masking and schools, because of course, with the number of cases that we're having, and especially the cases we're having in that 0 to 19, largely unvaccinated age group, there's a lot of concerned parents, and certainly want to speak to some of their concerns as well. Let's talk about masking. I've brought up all these points before, but I think important to reiterate. We are at a very high community transmission level of COVID-19. We're dealing with a very contagious virus, and we're dealing with a variant that has been making a lot of people sick across all different kinds of age groups and landing people in the hospital as well. It's going to be, it is critical, and more science is demonstrating the effectiveness of masks. I'll talk about in a moment that effectiveness is a spectrum for different kinds of masking, but we certainly recognize that the highest risk people have is when they are in indoor spaces with people outside of their household. So please, I'm encouraging all persons, whether you're vaccinated or not, all persons at this time of high community transmission and a very contagious Delta variant, if you are in an indoor space with people outside of your household, please mask up. Outdoors, we are recommending people to mask outdoors when they are congregating with people outside of their household, especially at large events. You know, for example, like the event we just went through at the county fair, or other events, festivals, community events where you have large people gathering, even in outdoor spaces. That's a time where I strongly encourage everyone to be masking in those environments, especially critical for those who are unvaccinated, including children.
Dr. Brewster, based on that, looking at the science and everything that you've already stated, sitting here without a mask on, of course, would you recommend that we have signs on county facilities that say wearing a mask is highly recommended? Even if it's not in whatever portion of the pandemic policy we're in, but something to encourage people that are coming in to
Absolutely.
wear.
I think signage is really important. The signs you currently have posted outside suggest masking only for unvaccinated people. I would strongly recommend that those signs be updated to reflect what's actually going on in our community now and the risks that everyone has in indoor spaces. The last is a point that, I raised some weeks ago and continue to reiterate, especially as our surge continues. For employers, for facilities, for events, and again, to speak to Commissioner O'Connor's point, please consider requiring masking in all of your indoor kind of publicly or gathering spaces. And utilize signage to help with that. We're about to send a letter out to businesses, and we have example signs available on our webpage as well that anybody can download and print out, so for easy use. And encouraging masking outdoors if you're having a group gathering outdoors or a large group event, especially like a festival or a community event where we have people congregating.
Dr. Brewster, I was on a Zoom meeting last night. We're at Lexington Park Rotary, and they're getting ready to put on the Oyster Festival, and this question came up. I strongly agree with your idea of recommending, but what I have to say is these are your personal recommendations.
These are my professional recommendations, sir, as a physician and as a public health professional.
Well, what about the CDC?
The CDC also recommends this. Some of this is based on the fact that we have local high transmission. So the CDC actually defers to local public health authorities in some of these recommendations because each of our jurisdictions is different. We have about 55% of our population vaccinated. That's about 45% who is not. We are seeing, as I showed, very high levels of COVID-19 transmission. In a situation like that locally, it's even more important for people to protect themselves, which is why these recommendations are here.
I guess my point is I strongly agree with vaccines. I'm vaccinated myself. I strongly agree with people being vaccinated. And I'm not trying to say I disagree with masking. But what I guess is why doesn't the CDC and Governor Hogan, because we take our direction from elected leaders who, the President of the United States has put out his, but he hasn't gone to masking. I guess my question is it's inconsistent when we talk about requiring it locally if we want to. We can be more restrictive than the governor. We can be more restrictive than the feds. But it's kind of contradictory to what we're hearing.
So the governor has taken the position that he would like local jurisdictions to make that decision. He's been very vocal about local jurisdictions making those decisions. Several local jurisdictions in Maryland, as you know, have made those decisions to implement masking policy, and that is certainly something to consider. I think there is a role for the Board of Health here locally to look at the science, to weigh all of this, and to determine a policy that is effective for its population and in protecting the health and safety of its residents. I do think that masking policy is effective. We know that from what we live through already. When you have a policy in place that requires masking, while you might not have 100% compliance, you certainly do have greater compliance than what we're seeing currently with no policy. However, I do think that there's the We've been encouraging our employers and our facilities to implement their own policies because they have the right to do so, to implement policies that require masking inside their facilities. And we continue to encourage employers and businesses and events, including groups that are holding festivals and so forth, to implement that. And that is the guidance that we as a local health department have been providing to those that have reached out to us or to those that we reach out to.
There's two sides to this, Dr. Bruce. I've had this conversation with you, and I've had it with several others. I look at it from the stance of not the political stance, because I don't think that should be entered. Science and politics should not be one and the same.
Agreed.
It just shouldn't. However, I do believe that, if we encourage people that live here to go ahead and take all the precautions, regardless of the wrath in which it brings upon you for even recommending washing your hands. The thing is just like there's a law for seatbelts, there's a law for drunk driving, there's a law for everything else. But that's a law because it's the motor vehicle side. But what we still do is campaigns to recommend people to wear seatbelts.
Sure.
Of course, with any mandate, any law, it becomes who's going to enforce it. Well, that's pretty spread thin right now, dealing with
Agreed.
plenty of other things. So a mandate or a law is only as good as those that can enforce it or be there to enforce it. So that road, we already know it's just going to be a mess. So looking at education, right? And so my angle on the non-governmental side, those that don't work for the government, is we strongly encourage you to wear your mask, wash your hands, take whatever precautions that you should be taking, just like we tell you to wear your seatbelt. But if you choose not to wear your seatbelt and drive 100 miles an hour and crash into a tree, well, it's on you because you didn't wear your seatbelt. It's a very harsh comparison, or however you want to look at it, but that's the reality of it. If you're not willing to take any, it's the same thing as unprotected sex. We have prophylactics for a reason. If you choose not to use it, well, then you're taking that risk. It's sort of, we've had a more in-depth analysis of that, but I'm not even going to touch that one right now. But it's my point is that through education and prevention, it's education and prevention. But if you choose not to participate, there are people that are helping lower that risk on the other side.
Yeah, and that's a challenging discussion. I think the examples of the seatbelt and so forth, absolutely. There's health risk, individual health risk associated with the behavior. In a pandemic, there's also public health risk.
Right.
And it's not just about your risk of getting infected, it's about your likelihood then of spreading that infection while you're pre-symptomatic or asymptomatic to several others in our community, which is, again, why we're dealing with the surge that we're having currently and the pandemic that we're dealing with right now. So, I think I think that's an excellent point and certainly a strong perspective for everyone to consider, but we also need to consider the public health aspect of this virus, which makes it unique and especially, there's a different dynamic associated with that because of that public health aspect.
Yeah.
Well, I can see changing our signing, just like you said, to upgrade that says, we recommend you wear a mask inside of our facilities.
Right, or you could go further and you could require it.
Yeah, one or the other, but I definitely recommend we do upgrade. If we got masks that say that optional, I agree, we should upgrade, definitely to change the public's opinion. And I don't know what else to do. I've talked to several people that are not getting vaccinated. They blame it on religion. They blame it on it hasn't been tested long enough for them to accept it. Whatever their timeline is, they couldn't tell me. Mm-hmm. But I think they're foolish. You got a lot of people like that out there, and I don't know what else to tell them. I said, I think you're foolish not to get it done. Because it's proven, you've proven to us over and again every 2 weeks about the number of cases are extremely high with non-vaccinated.
Yeah.
So those of us who are vaccinated, more than likely you won't be hospitalized, but you can still get the variants that are out there. And that's always going to be with us. And I don't know what else to do to people to
Yeah,
convince them.
and it's, to speak to the conversation earlier, I think, it's understandable that people have questions, and it's understandable that people are concerned and cautious
Yes.
and want more information or want to evaluate and want to make their decision. And so I understand that. I think it's perfectly reasonable and good for people to be critical in their thinking and to be making cautious decisions when we're dealing with things like this. I think, though, we are at a time now where the evidence and the scientific evidence and the medical community recommendations are very clear, and that these vaccines have excellent safety profiles. Excellent. Some of the safest vaccines we have dealt with are in these vaccines. And the vast majority, and in fact, if you're going to see a side effect as an individual taking this vaccine, if you're going to see a problem with it from the vaccine itself, you're going to see it within the first handful of weeks, maximum couple months of taking that vaccine. These vaccines have not been associated with new problems that show up 10, 20 years down the road. Oh, that's because of a vaccine I had 20 years ago. That's not how vaccines are designed or working. They're not medications that you take every day for your life that stay and build up in your system. And especially these mRNA vaccines, they have incredibly short half-lives, where that mRNA, that information packet that's being delivered to your body to teach your body how to recognize the virus, that disintegrates very quickly. It's got a very small, low, short half-life.
That's why we're putting out boosters now, because it's deteriorating.
Well, the disintegration is of the messenger, right? The impact on your body is that your body learns how to make its own antibodies, so that if you get infected, you don't need the ones that the lab made to treat you, right? So your body makes its own antibodies and builds up that level of immunity. Now, in time, immunity declines, and as we get better and better about dealing with this virus, and as the virus mutates less, because the numbers of people and the presence of the virus gets lower and lower, we'll have a more stable virus to deal with, and we may have a better ability to extend out the impact from the vaccine. And maybe it ends up being like a seasonal flu vaccine. Maybe it ends up being like something like tetanus or other vaccines where you get periodic boosters. That's natural. That's what we've dealt with in vaccines before.
So what I'm reading our pandemic response policy, just to follow this here, and based on the transmission rate that you're seeing in the cases, even us exceeding Baltimore County and a few other places.
You're a hot spot in the state.
Right. We should, I think we're in pandemic 2 right now, correct?
Correct,
All right. So based on the public health officer, would you recommend us moving to a pandemic response level 3 based on the transmission rate?
My understanding of the county pandemic policy is that you've already met the criteria for pandemic level 3. And I do think, as we've spoken about before, that there's a role for county government to recognize the situation around them in the county and protect its workers and protect all of the people in the public that are utilizing its services. And so if mandatory masking is part of that pandemic level 3 policy, which I believe it is, I do think that will be effective at helping to protect your workers and the residents who utilize your services.
Well, like I said, I believe in removing the politics out of it. We have a policy for a reason. The policy has been vetted. And it has the recommendation of public health officer in here and staff. If we've met that criteria, I just want to make sure that as the public health officer for county government, right, this is what I'm talking about.
I'd be happy to speak with Dr. Bridget some more and go through that policy with her and talk about the implications on county government operations and balancing those implications with protecting your workforce and residents who utilize your services.
I appreciate that. Thank you very much.
Sure.
So can I shift gears just slightly to a related, but you had mentioned urgent care earlier, and we know that in our county, across the nation, our healthcare workers are just
Overwhelmed.
stressed. They're
Yep.
overwhelmed,
Fatigued.
burning out.
Yep.
It's happening a lot. And I've seen a lot of conversation online about frustration with our urgent care. And I don't know if you have any insight into this, but someone specifically reached out and asked why they were only taking patients by appointment with no walk-ins. And I think I'd
Yeah.
heard that the walk-in wait time was 3 to 5 hours for
Sure.
urgent care clinics. And I guess the fear is that somebody might have minor COVID symptoms and decide to just not even go there for a test because it'd take too long. Or
Yeah. So we have a limited healthcare provider system, right? We have limited people, limited facilities. We can't unnecessarily compromise that system so that then it's not available to provide treatment and care, not just for COVID patients, but for all kinds of health conditions, including the chest pain that walks into the urgent care. So it's really important for healthcare providers and healthcare facilities to, one, be able to serve patients, right, to be open and accessible, yet at the same time balance that with the need to preserve the safety of their own workforce, as well as all the other patients that come and use their services. And so that's why if people have COVID-like symptoms and they want to get a COVID test, and they're contacting the urgent care or a doctor's office, that's often why they're done by appointment rather than walk-in, because then they can stagger those people out so that you're not having 20 people with COVID symptoms in a waiting room that also has 20 other people who are sick or underage or older and have all these other, and potentially pass that COVID infection on to those other people, as well as all the staff in that building.
Now, I haven't been to urgent care in a while, but I was told that at the beginning of the pandemic, they're requiring patients to wait in their cars until it was their appointment turn, but now they're going into a waiting room, and the idea was maybe they should go back to waiting in cars.
Yeah, and that would be the decision of the practice. They also have to have staff that's able to go out to the cars. So I don't know how their workloads are. I do know that they're heavily, their workloads are incredibly heavy right now. We're trying to offload some of that by ramping up all of our testing operations. But again, we have limited capacity as well. I mean, we're limited by public dollars. We're limited by the need to contact trace 630 some cases. And contact all those close contacts. We're already getting behind on that, and also running up all these booster and first dose vaccine clinics. So our workforce is pretty strapped as well. So
This is a nationwide issue. This
Absolutely.
is a real problem that we're not going to be able to solve here.
Right.
But
it's especially, it's causing especially great impact in communities like ours that are surging so much. And again, another reason for people to consider when they're making that decision about getting vaccinated. It's not just about them, it's about this whole systemic impact on their community infrastructure, their healthcare system, their public health infrastructure, and so many others, their first responders that are now bearing the weight of that decision not to get vaccinated.
And to Commissioner Colvin's point, the Navy clinic is not allowing you to come in there if you're showing any symptoms. So they're telling you to go to the ER regardless, or any other type of sickness that is combined with. So, and this is as of today. So that's, dealing with a situation where now there's a 4 or 5 hour wait at the urgent care, sitting outside in a car, waiting to be seen.
Yeah.
So there's a ripple effect that happens when each one decides to put tighter restraints in, such as the Navy clinic is doing now, pushes out into the community, affects the ER. But that is a very solid point Commissioner Colvin was making.
But they also need to protect their workforce, otherwise they can't serve anyone.
Correct.
Right? Absolutely. Great points. And again, this ripple impact is not just affecting people seeking care for COVID. As we've seen across the country, this ripple impact is affecting that 5-year-old that's coming in with a bellyache or a broken bone, or that 60-year-old that's coming in with chest pain, or anybody else who's coming in with an appendix problem, or whatever it is. The challenge of getting access to health care that is worsened by people getting sick from COVID or needing medical attention because of their severe COVID illness is impacting everyone in our community in terms of their access to healthcare services. Another key point about masking, and I'm bringing this up because we certainly had a lot of questions from parents, and we have also provided guidance to schools, which I'll talk about in a moment, is that masking is on a spectrum. Just like anything else, there's a spectrum of effectiveness. And when you're dealing with a highly contagious variant, like what we're dealing with now, the Delta virus, and there's high community transmission of a virus, and we still have almost half of our population unvaccinated. It's even more important to look at the effectiveness of different types of masks, and especially for those who are unvaccinated, to consider upgrading the quality of their masks. And that includes for children who are not yet age eligible to get vaccine. So the multi-layer cloth face covering, like what I'm wearing right now, on all of these masks that I put on here, the snug fit is key, right? So we don't want gaps and lots of air coming out through the sides, through the bottoms, through the top. It's ideal to have a nose piece that conforms to the shape of the bridge of your nose so that the mask stays in place better. And maybe some way to tighten it so that it makes a snug fit around around your face. So there's the multi-layer cloth face coverings, not single layer. We're talking about multi-layer cloth face coverings. And the quality and the effectiveness of these multi-layer cloth face coverings, if it's a snug fit, if it's multi-layer, it's going to be far better than some of the single-layer cloth face coverings that people are choosing to wear. However, some of this quality or of effectiveness for even the multi-layer is affected by the type of cloth that's being used, and again, the fit of the mask around the face. Double masking is an upgrade to that. And double masking is, for example, taking a disposable mask, such as the one shown in this picture, and putting it underneath the cloth face covering. The cloth face covering will actually help that disposable mask conform better to the face as well. And it's usually those disposable masks are very thin. Even if they have multiple layers, they're made of a thinner material, and so that thinner material usually doesn't cause as much, it doesn't warm up the face or anything like that. You can still breathe very well even through the double masking. The ones shown on the bottom are the ones that I currently am recommending to everyone who, especially if they're unvaccinated, that they consider one of these higher quality masking. And that includes parents who are sending their children into school, including those children who are unvaccinated. They're in a higher risk environment with an indoor setting. So there's the one on the side of the slide here at the bottom, the medical grade. So this is a medical grade, so you want it to be ASTM rated. There's a lot of masks that look like this, but are not medical grade. They are not ASTM rated. But these, we recommend the medical grade, ASTM rated surgical masks. And usually they have 3-ply or 4-ply or even more, but that's what we would start with. And perhaps even more effective than that would be a KN95 mask. Now, the KN95 mask, the one in the middle on the bottom, those, when parents are looking for these things online, or others are looking for these things online, I would recommend going with a company that's FDA registered, and then get a product. There's been several that have come out since then, so they may also be worthwhile. But to start with, you can look at the list of KN95s that were previously on the emergency use authorization list from the FDA. That emergency use authorization happened because healthcare providers were not getting access to N95s. So in the time when we had a shortage of N95s, during this pandemic, the FDA issued an emergency use authorization for KN95s, so healthcare workers could utilize that, because these KN95s are approved by bodies similar to the FDA, but in other countries. And so if certain manufacturers met certain standards, they were put on that FDA EUA list. Because we don't have that same shortage of N95s that we did in the beginning of the pandemic, the FDA ended its emergency use authorization for KN95s for healthcare workers. However, that list is still a good list to consult if people are looking to purchase it for personal use. So that's the KN95s. And they do make some in smaller sizes that are better for kids' faces, as well as with the medical grade surgical masks. The N95 is another option. We still are encouraging people to utilize this mostly in medical settings or school nurses, for example, or others who are providing kind of close contact care. The best way to use an N95 is to get it fit tested for your face. And so that tends to happen more in medical settings or where you're providing healthcare services. But the N95 masking itself is also a very effective mask. And if it's fit tested, it's certainly more effective than any of the other ones on this slide. It may be harder to access, and again, if people don't get fit tested, I don't know if the cost of the N95 would be worth it for them compared to just going ahead and getting the KN95 or the medical grades ASTM rated surgical mask.
Dr. Brewster, you just mentioned the kids in the schools.
Mm-hmm.
Around a year ago when all this was taking place, we went through a massive accumulation of masks.
Mm-hmm.
And the school system says we have so many masks we can take care of the kids for a whole year. Do you know if that still may be the case?
Yeah, so the schools do have some masks that they make available. So if a kid shows up without a mask or they forgot it, they have some masks that they're available. They're like, I think they're 3-ply masks. I don't know. I'm pretty sure they're not medical grade, but I know the school system's looking into that. But they are multi-ply face coverings that they can use for that purpose. So they do have some of those that they're distributing as needed. And again, a child can double mask with that as well. They can use that as a paper mask underneath their cloth face covering to give them some extra protection. This slide and some of the strategies I'll mention on the next page that are geared towards schools are really meant to encourage parents to consider getting their own, if they're able to, of some of the higher quality masks if their children are not vaccinated especially.
Thank you.
And ideally, if their kids are 12 and older, get them vaccinated. The last are some strategies, and these are strategies that we've communicated to the public schools, to non-public schools in our county, and we actually have a letter going out shortly to all the schools in our county that reiterates some of this, and some of this is on our webpage as well, on our health department website, or will be soon if it's not there already. Our goal right now is recognizing that in-person learning is really important to the development of our children, to their mental health, to their academic achievement, and we're trying to do what we can to preserve in-person learning. We also recognize that in-person learning in these indoor settings with largely unvaccinated populations is a breeding ground for COVID. And we have been seeing, as I showed earlier, and as if somebody goes to the public school website where they report out the cases per school, that there's a high number of cases in these indoor settings. But because we're trying to balance the benefit of maintaining in-person learning with the risk of COVID, it's even more critically important that schools consider some of these mitigation strategies. So number one, as we've been talking about, if you have staff or age-eligible students, encouraging as best as you can them to get vaccinated or their parents to get their kids vaccinated. Two, requiring masking in these higher risk indoor settings and making those quality masks that I just talked about readily available if they're able to distribute them or have them available to the students and teachers. Third is to open windows. So this is all about ventilation, and the next one is about air filtration. So if you have windows in classrooms and in cafeterias, we're in a better weather season now, this is the time to keep them open. Open windows on the buses. I know the school system, the public school system has already given guidance to classrooms and to bus drivers to open their windows. If parents are concerned that their buses' windows are not open, or that their child is telling them that their classroom windows are not open, they can certainly raise that to the attention of the school system. They have an email, I think, that they could report a concern, so that they can look into that. But again, I encourage all teachers and all bus drivers, for your classrooms and your buses, please open those windows. That ventilation is so critical in this multi-layer approach to mitigating the risk of COVID. HEPA air purifiers in classrooms or in cafeterias or common spaces where kids are. Again, this isn't, we've had parents reach out, what can I do to help? This might be a great way for parents of a classroom to pitch in resources together and raise money for that classroom to get a HEPA air purifier. It's not fair to I think, to add on to a teacher. They already expend a lot of money on their classroom supplies. This might be a way that parents can really step forward and say, okay, let's pitch in some dollars across the 20, 30 of us to help get our classroom a HEPA grade air purifier unit. And then, of course, moving all activities that are feasible to be moved outdoors, moving them outdoors, and cohorting students in the lunchrooms is really important too, especially because they're taking their mask off to eat their food. So maintaining the same group that they're exposed to around them, so that we can better track who might be a close contact if somebody comes out positive, and control that spread of infection. And then also there are resources that the state is making available to both public and non-public schools to offer testing programs, so that resources for testing are more readily available on school sites or sent home with students as a screening initiative or even as a diagnostic initiative. Right? And I'll end with this. Again, I think the data, the science, and our imperative to serve our community and be a part of healing, beyond our own health, is hopefully encouraging individuals to make that decision to go get vaccinated. So please, anybody who's not currently vaccinated, please consider taking that step now. Like, as I said before, a few weeks from now, we expect our vaccine supply to become a little bit more constricted. So if you're on the fence, or if you know you're going to get vaccinated because of a work requirement, please take that step to do it now, before it's harder and harder to access vaccine later.
Dr. Brewster, one thing I wanted to address publicly that I've had a conversation with you about. First of all, when I'm up the road, wear my mask. When I go into the grocery store, wear a mask. There's certain situations due to, one, my son not being vaccinated, my in-laws, various different things, that I take precautions because I feel it's the right thing to do. The conversation, though, is the bullying that goes on that's the term I'm going to use, back and forth. And, it's unfortunate that this topic of whether you're going to wash your hands or wearing a mask has risen to the level of government employees, our citizens, being either mask shamed. I think I'm making that up, I don't know, but that's what's going on. And the bullying from one side or the other that has become so divisive. Or divisive, I think. I probably mispronounced that one. But yeah, I think you know my point. Is there any message that the health department is doing beyond it's good to wear a mask, or any, for those that are dealing with the pandemic fatigue, to really reach out and say, look, I've hit my COVID fatigue. I mean, I had that conversation with you because I told you I'm tired of hearing about it.
As am I.
And point blank, I have no problem saying, you know what? After I'm done at work talking about it, the last thing I want to do is talk about it at home. And it just gets on that last nerve. So what mental health options are available for those that, are just like, look, I'm here, I'm worn out.
Thanks for raising that, Commissioner. I mean, I think that's something we've recognized throughout this whole thing, is that the behavioral health impact of this pandemic, in many ways, just the general stress, the change in society, the change in what's happening with kids and all of that. And then, of course, seeing loved ones get sick and dying and so forth. I think that's a big impact. So a couple things in response to that. One, resources are available. Mental health, behavioral health resources are available. I was just on a call a couple of days ago with our local behavioral health community of providers who are working so hard to make their behavioral health services available to our residents, despite the pandemic and despite the risk to their own health and the health of their staff. They're deploying new ways of making services accessible, including telehealth, telebehavioral health even, so that people on their own time and kind of in the comfort of their own space can reach out and have that connection and therapeutic intervention with a behavioral health professional. We do have a resource guide that's available on our website of behavioral health providers here locally and other behavioral health resources here locally, including ones that are available through telebehavioral health. So I encourage our residents to check that out. We've updated it a few times already to be very current. Again, it's on our website. We also have several other resources available to support individuals who might be struggling or who think their family or friends may be struggling. We have a screening tool on our website as well, where people can do a simple evidence-based screening tool to figure out, hey, is this really just COVID fatigue, or is this kind of getting into the depression environment, or am I dealing with a generalized anxiety disorder that really needs more significant intervention? And so we have those tools available. There's also a variety of resources that the schools have made available, and that we've worked with the schools for some time now, and then that they've increased resources for students in school settings related to mental health and support for kids and staff who might be dealing with more stress or anxiety related to the pandemic. So there are a variety of resources available here locally that people can access, and I appreciate your attention to this. I think it's something that we're going to continue to see the impact of for months to come. And as you recall, I had put a proposal in front of you for funding to renovate that hub building and the old PNC Bank building so that we could offer a behavioral health crisis stabilization center for our community. Because I think it's really important for us to do that now so that we can be ready for the recovery needs that we have as a community from a behavioral health perspective. So I'm hopeful that we can continue to build more behavioral health resources for our community as well.
Nice plug. I wasn't expecting that.
Thanks, Brett.
Thank you very much, Dr. Any questions, Commissioners?
Thank you for your time, Dr.
Dr. Brewster, thank you very much for the update, and we'll look forward to you talking with our
Yes, sir. Absolutely.
Dr. Bridget to look over our pandemic policy.
Wonderful. Will do. Thank you all. Thank you for your
Thank
time.
you very
this
much,
morning.
ma'am.
Move to adjourn as St. Mary's County Board of Health and reconvene as the Commissioners of St. Mary's County.
Sec.
All those in favor? Aye. Any opposed? Ayes have it. Thank you very much, Dr. Brewster. Next on our main agenda, we are going to finalize our legislative proposals with the Office of the County Attorney. Mr. David Weiskopf, our County Attorney, will present each one of them. And we need to go through the motions. Is that correct?
Yes, sir.
That's to get ready for our delegation meeting next week.
Yes, sir. We have, as you're aware, we have 10 proposed ones.
Okay.
The first one was to request change to amend Chapter 49, 1B, 2C of the Article 19 of the St. Mary's County Public Local Laws to amend the emergency service support tax per $100 of assessable real property to an amount to be determined by the commissioners. There's been no changes to it since we discussed it last week. I don't know if anybody has questions about it or...
Actually, Mr. President, this was my request based on a few factors previous to the last financial reporting that we got in. And based on the numbers from the state, our economic stability, and the fund balance that we're going to have, I do believe that we don't need to touch this emergency services support tax now. So I would request that we table it until the next legislative session, if necessary.
Do you want to delete it this time?
Yes.
That's up to
yeah.
you. Okay.
Yeah, absolutely.
Okay.
I think we're going to be in a good financial situation where we don't even need to worry about this. So I think it's solid.
Okay, we'll delete it.
That one's easy. The second one is to request an amendment to certain articles of the annotated code regarding the transportation article regarding where a person may drive a golf cart in St. Mary's County. And this would enable, excuse me, the county commissioners to decide if a certain street, if it meets certain requirements, could have golf carts driven on it.
All right, I move to request amendment of Section 13-402C12 and Section 21-104.5 of the Transportation Article of the Annotated Code of Maryland to authorize the Commissioners of St. Mary's County to designate on which county highways a person may operate a golf cart in St. Mary's County and exempt golf carts from motor vehicle registration requirements in St. Mary's County under certain circumstances, and to approve and authorize the Commissioner President to sign letters of support to the delegation and to House and Senate committees.
Second.
Discussion. I see we have the sheriff here. Can we find out if we've had any incidences where golf carts and automobiles or golf carts and have not been safe on highways?
Right, because in St. Mary's County, we do allow it by state law in Golden Beach. So are you specifically asking about that?
Well, I know
Or just anywhere?
Well, we've allowed it, and we've had some time to have some history on it.
Sure.
So if it's been okay, I'm okay with it, but if it had, I'd just like to know if we've had any incidents.
Off the top of my head, I can't tell you an instance of a problem, but I'd have to research.
Okay, I guess the answer is no, we haven't had any things.
Obviously
that-
not.
But the answer, I believe, was that off the top of his head, he could not say yes or no. He'd have to research it. But we can certainly reach out to the traffic division and ask for their input on it.
I mean, I'm not opposed to it.
Right,
It's like
right.
we've had any problems.
Certainly.
There. Thank you.
You have a first and second, all in favor? Aye. Any noes? Ayes have it.
Thank you. And the next was to amend local government article, the annotated code, to revise the St. Mary's County Human Relation Commission's duties language.
That was pretty benign. I move to request an amendment to Section 29-106B1 and 2 of the Local Government Article of the Annotated Code of Maryland to update the duties language of Human Relations Commission and to approve and authorize the Commissioner President to sign letters of support to the delegation to the House and Senate committees.
Second.
I have a first and second, all in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioners. And next was to amend the St. Mary's County Public Accommodations Tax, enabling legislation to go from 5 to 7, if the Commissioners so desired.
I think it's important for the citizenry to understand that part of this request also deals with our tourism. And one of the things that's been lacking in the tourism budget is monies. And this accommodation tax would probably, I think, whatever the ratio is, greatly, based upon hotel accommodations and reservations, greatly be able to enhance the revenue that goes to Visit St. Mary's, which would increase tourism, or hopefully increase tourism here at the end of the day. I think it's very hard, quite frankly, to ask for a tax increase, especially in this setting, but recognizing that the purpose is not so much to enhance the county coffers, but it is to make sure that there's more monies to enhance Visit St. Mary's and provide more tourism revenue dollars here to the county.
Well, what I worry about is we have Solomon's right across the bridge with a big Holiday Inn over there. And I think their rate is 5%. It'd be lower. But what really drives my thinking on this is these Airbnbs. And are they paying their share? I mean, we're seeing such an influx of those things. And it doesn't seem to be we have any regulation, or do we have regulation to collect the tax money on Airbnbs?
They're supposed to pay. My understanding is they've been sent letters to, from the Finance Department or from Department of Economic Development, I'm not sure which, to pay. If the commissioners would like my office to look into ensure that everyone, it's something we can do.
Well, I guess my point would be is, I think Visit St. Mary's is doing a good job. I'm glad we've gone in that direction. I just don't want to raise a tax if we're letting somebody else who does that kind of accommodation off the hook.
Right.
Those Airbnbs are really coming to be very popular, and there's a philosophy of, well, I'm renting my home. Should I pay a tax on that? Should people who, lease their houses for tenants, should they pay a tax?
Right.
I mean, it's a sticky wicket. But still, Airbnbs, and specifically this one family that deals with out in Leonardtown here with, 2 days, 2-night stays, that kind of stuff should be taxed, whether it's 5% or more.
And it certainly is taxed. It certainly falls under, I think, public accommodations is Chapter 267 maybe of our public local laws, and I believe that an Airbnb does fit the definition of public accommodation so that they should be taxed.
Also know there's a lot of them down in Scotland area, specifically Scotland Yards. And it's important for me to understand if they're paying their fair share.
Sure. I can get with finance and look into that.
Now, this is part of I proposed this. Number one, we separated tourism away from county government 2 years ago, and their main focus is their money's coming from this taxation.
Right.
Now, I'm asking for authorization to increase if we need to, but right now, based on last year's funding, whatever, it didn't do very well. So it's one of two things here. If we don't do this, then if they need monies, it's going to come out of our general fund somehow to pay for their needs. Or we increase the tax so that they can pay on their own. And that's the main purpose of having this taxation.
But I think the idea of them forming that group is predicated on the idea that having somebody do that would increase money.
Well, it's true. Yeah, and we haven't until a couple of years ago started pushing for the Airbnbs, HomeAway, VRBO, all those that are out there, and there's quite a few of them in the county, believe it or not.
I guess my point, Commissioner Guy, is we've already had one director come and go from that Visit St. Mary's group. That's not a plus or a minus on them, but it still needs maybe some time to mature. I just haven't seen a real benefit to going in that direction.
Well, this is not a bill to increase it. It's just in case we do need to.
So I don't agree with Commissioner Hewitt's point that he's made before about the Holiday Inn and us losing business overseas, but I do agree very much with, or losing business over the bridge, overseas, over the bridge, same difference.
Over the river.
I do agree with the Airbnbs, and everybody should be taxed fairly there. I don't support this move right now. I supported this in previous years, but I think it's pretty clear that our state delegation is not going to take this forward. I think it would be a waste of time for us to even bring it to them. Personally, I agree with you, Commissioner Guy, that this would be a good move. It's only providing authorization to us. It doesn't actually mandate a tax increase. And when I supported this in previous years, I separated it from Visit St. Mary's. I was not in favor of increasing additional funding to Visit St. Mary's at the time, other than the current percentage that they get. But anyway, I'm opposed to this right now.
Yeah, I think the point is, if there's money on the table, that's money left on the table, and it's not already being taken, why would you increase something or have the ability to increase something on the brick and mortars that are already paying their share of the taxes? I think if Visit St. Mary's needs more funding, then they need to reach out to the county attorney and take a harder stance on collecting this revenue and from Airbnb and everybody else that's not paying. That's the data I would like to see, because maybe we make up that 2%. I think it's going to be over that from Airbnb. I mean, especially with some of the situations we've heard. And I think, again, our fund balance and estimating the growth rate is, even if it is something that's $50,000 to support them.
This is not taking our tax money away from anybody. It's anything, it's increasing the tourism coming in. The tourists are paying this money, not our citizens.
Yeah, no, I'm with it.
If this can't be done, the only thing I can say is what'll happen is we'll have to use our own fund balance. And it's true, it looks good right now, but that's just this year. We don't know what next year's going to be, or the year after that. So, and this just gives it authority. It does not do anything about increasing it at this time. But if it's strong against it, then I'll just pull it.
I think it's a wise decision.
Yeah.
Let's
my
let's
logic-
delete it from the motion for delete.
Okay,
Commissioners will also follow up, because I think you need enabling legislation to require the Airbnbs to pay. Right now, we do have a registry, we do bill them, but I think you'd have a higher collection. Other jurisdictions in charter counties, for example, have regulatory guidelines. So we'll explore some of that and just give you that information in case you're interested.
I could tell you, I could get behind that right there. I mean,
That should
I
be
could
a
get,
statewide bill
Yeah.
there.
I mean,
It was not statewide, because it's just
No.
individual counties, it's not going to be statewide.
It should
But I
be
agree with that, something like that to be done.
now, is that the same amendment?
well, we had looked into putting some teeth into Chapter 267 of the Public Accommodations Tax, I don't know, 7 or 8 years ago, when we had a scofflaw that, that owned a hotel that didn't pay his tax. Yeah.
Now, that is, I could get behind that. I
But
mean,
we
easily.
could, that might be,
That back?
Yeah, we can certainly look into that. That might be something we can
Okay.
do without
Let's bring that
Annapolis
back
and-
then. If we can do that this year, it'd be fine.
Yeah,
Okay.
that'd be great, yeah.
Thank you. Happy
Certainly.
to do that.
Now we're down
Number
to
5.
8. Number 5 is regarding the public safety officers, otherwise known as animal control officers, to wear cameras, body-worn cameras. And my understanding of the law right now is that only law enforcement officers are allowed to wear body-worn cameras, and animal control officers do not fit the definition of a law enforcement officer. And this has to do with, we were saying earlier, the Maryland wiretap law, right? That you can't audio record somebody without their consent. And, the way the law is set up, while it's true that the animal control officers could probably wear the body camera now, they'd have to ask permission, they'd have to turn it off and on, and anytime somebody else walked into the camera, they might have to do the same thing, and there are lower expectation of privacies if they're outside somebody's yard or on the street versus if they're on somebody's porch or inside somebody's house. So this was just a good way to, give them the authority to do it.
Do we have any cases of suits being filed against the county because animal control officer was mean to somebody's pet or something like that? Do we have a record, any kind of
No,
documentation?
we do get some, as you know, people, tend to love animals very
yeah,
much.
very
and
much so.
A lot of these are neighbor disputes, right? That somebody's letting their dog or animal run onto somebody else's property. So these do get quite heated. And quite frankly, that's just the way we're going, right? Everybody seems to be a little angrier lately.
Well, we
Yeah,
had
wait.
our Board of Trustees
Weisskopf.
meeting related to this.
I'm sorry?
We legit had the Board of Trustees meeting, and I brought this up about us taking this legislative step. Of course, from the risk management side, it gained great support because we fully expect, and we're seeing a rise in animal control law enforcement claims that are through the roof. And with new changes in legislation, we only expect them to go higher. This is actually probably going to be used as a best practice in order to see how it goes and when we lower the risk, and are there going to be any reductions in overall premiums, which hasn't been set yet for these types of things that are in place. So there is some other things now. They're working on the legal end of it through the letter of support. And while there's some opinion that it could be done now, they feel that a firmer black and white letter would be great. But beyond the risk management, the evidentiary value of these cameras is great.
I agree
So,
with that.
Yeah.
Yeah, Mr. Weisskopf, I think it's reasonable if someone, enforcement officer or animal control officer, I'm sorry, comes upon an animal that's very aggressive, that this would be helpful, especially if, God forbid, the animal control officer has to put the animal down. Because then you get a situation where, hey, my dog wasn't that bad or my animal wasn't that bad. But isn't it reasonable to think that if someone wants to come on the scene, some individual, that the officer can say, I have a body camera, you're being recorded, are you okay with that? I mean,
Sure.
it just seems like this would make it easier for them to defend, the animal control officer to defend himself.
Sure. Like I said, I believe the animal control officer could probably wear the body camera now, but I didn't want to put that burden on them to realize when they should and should, when they should have it on, when they shouldn't have it on. Anytime a new person comes onto the scene, they've got to repeat that, and it could be a situation that's moving fast because of tempers, or, it just seemed a lot to put on somebody at the scene. I didn't want to.
I still support him.
One thing I'd like to see, though, is because they could be wearing them now, is a policy on it. I would like to see that, because you don't have to ask permission, you have to advise them, and then they have to say, no, I don't want to be recorded. We have reasonable expectations of privacy, a couple other things. Either way, I'd like to see how it's going to work. We've been talking about this forever. Even if it's one senior animal control officer that has one, I'd like to see emergency services work with you to come out with a policy so we can get this, see how this is truly going to be impacted and start
We
using
could do it similar to law enforcement. It doesn't have to be anything new.
Yeah,
similar to law
exactly.
Oh, right. I'm sure the sheriff's office has one we can take a look at, certainly.
Yes, but either way, I'd like to see that happen, and then as this legislation makes its way, at least we can have a test bed. But I move to request amendment of 10402C11 of the Courts and Judicial Proceedings Articles of the Annotated Code of Maryland to allow for St. Mary's County Animal Control Office to wear body-worn cameras to record the encounters and activities, to approve and authorize the Commission President to sign letters of support to the delegation in the House and Senate committees.
Second.
I got a first and second. All in favor? Aye.
I see we have Mr. Walker. Can you give us some insights in?
We voted aye, right? Everybody voted?
Yeah.
Any opposed? Ayes have it.
We actually did write a policy. I'll send it to you. We wrote it a couple of years ago when we first brought this. So I'll do that. And
Okay.
we'll actually bring it out and make sure it's up to date, that nothing's changed, but we'll send it to you.
Is it similar to the law enforcement policy?
It is very similar.
Okay.
It's based off of that. So
Good,
when we
good.
first had Neil in the county attorney's office review it, he says, I didn't know you already had a policy, so.
Good. Thank you. Thank you.
Okay, great. And next is also from Emergency Services requesting an exemption to the state law that they be allowed to use polygraphs in the employment process for EMTs and paramedics, and also for emergency communication center applicants.
Well, I'm going to move to request amendment of 3-702B of the Labor and Employment Article of the Annotated Code of Maryland to exclude St. Mary's County paramedic and EMT applicants and the St. Mary's County Government Emergency Communication Center applicants from prohibition of county pre-employment polygraph examinations or similar tests, and to approve and authorize Commissioner President Guy to sign letters of support to the delegation and to the House and Senate committee.
Second.
Have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioners. Next was to amend a section of the tax property article of the Annotated Code of Maryland requested by the Treasurer of St. Mary's County to provide for auctioneer fees of the actual cost. Right now, we're limited by this statute to $3, and her costs are roughly $10, per piece sold by the auctioneer, per property sold by the auctioneer. So she'd like it to go up to what the actual cost is.
Again, non-starter. I was involved in a public auction on Saturday at the courthouse steps. Now, is an auctioneer required for that kind of a service, or can the attorney do it? Who makes the recommendation on whether?
Now, that's different. That's a mortgage foreclosed. What I'm talking about is the tax sale foreclosures.
Oh, tax. Okay, I got you.
Yeah, sorry. I should have been more clear, but those are the tax sale foreclosures that we do once a year.
I think it says right here, tax
Yep.
property. I shouldn't.
No problem.
I move to request amendment to Section 14-813, Parent E, Parent 2 of the Tax Property Article of the Annotated Code of Maryland to amend the allowable expenses for auctioneer fees to be the actual cost charged by the auctioneer for each property sold at tax sale in St. Mary's County, and to approve and authorize the Commissioner President to sign letters of support to the delegation to the House and Senate committees.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioners. And next is actually from my office requesting to amend Section 1-113 of the General Provisions Article of the Annotated Code to amend the definition of newspaper and newspaper in general circulation.
And just so I'm clear on this one, you had said that the free newspaper had a circulation or we didn't know the circulation, but had a publication rate of like 10,000?
Yes, sir. My understanding is the free newspaper has a publication rate of 10,000 copies and is distributed in 120 different locations in the county.
So would that be a prerequisite to being declared a newspaper? Again, I
No,
worry about ones that are very limited.
The newspaper, as it is now, there's, I think, 5 definitions, and there's 5 elements to the definition, and one of the elements currently in state law is that it be a paid periodical. So we're taking paid out, but we're leaving all the other ones in, which is that it be at least 4 pages, that it contain news items, current events, editorial comments, advertising matter, and other miscellaneous information that's of public interest. It be published and distributed by sale from an established place of business at least once a week for 6 months, so it has to have a 6-month history. This one has like a, 15, 16-year history. A general circulation throughout the community where the publication is published, and it qualifies for periodical rates under the U.S. Postal Code. So what we're basically doing is taking out the for sale part.
Okay.
I move to request amendment of Section 1-113 of the General Provisions Article of the Annotated Code of Maryland to amend the definition of newspaper and newspaper in general circulation in St. Mary's County, and to approve and authorize the Commissioner-President to sign letters of support to the delegation and to House and Senate committees.
Second.
We have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioner. And next was the one put forth by Commissioner O'Connor relating to having a towing and immobilization on private property, sort of, I guess, what's referred to as like an anti-predatory towing bill.
Well, that one I read, and does that have a limit of $25?
Thank you for reminding me. We did make one slight change
Yes,
to it.
I was about to
And we redlined that and struck out the $25 charge and put in to be determined by the commissioners.
Yeah, because I mean, if we do have an issue with this kind of parking in HOAs or wherever it may be, if you had a $25, nobody ever show up.
Right. So we've changed that.
So it can be determined by who?
County commissioners.
Okay.
You would set it.
Yeah, that was never intended to be left in there. It was actually a typographical error. So I actually caught that and
thank you.
Shot an email over to the county attorney's office, and they fixed that one
You need a
portion.
motion?
Yeah, I move to request amendment of, I move to request to add Local Government Article 1210 to the Annotated Code of Maryland to include motor vehicle towing and immobilization on private property in St. Mary's County, and to approve and authorize the Commissioner President to sign letters of support to the delegation and to the House and Senate committees.
Second.
Okay, discussion. We don't have to put in there that the amount will be determined by the commissioners.
We made that change.
You've already, okay.
Yeah, so what we will be submitting to the delegates will be one that has that change in it.
Okay, thank you.
Okay, good. Okay, I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioners. And the last one was a citizen request to amend section of the educational article of the Annotated Code to limit elected members of the school board to 3 consecutive terms.
Okay, I want to remind the commissioners, we're just voting to move this forward. We're not voting yes or no on anything.
It's a good idea.
Yeah, I mean,
We're just moving it forward
I
this time.
advocate for term limits at all levels of government, and
I brought this up years ago and caught hell for it. Either way, I move to forward the citizens' request of 31101G of the Education Article, the Annotated Code of Maryland, limiting elected members of the St. Mary's County Board of Education to 3 consecutive full 4-year terms to the delegation.
second.
We have a first and second. All in favor? Aye.
I'm
Any
going to
opposed?
abstain, and I'm going to abstain because I believe this is a state issue. I was on the first elected school board in 100 years in 1996. That was something that the delegation brought forward up there. So it just seems that for us to take a position on it, while I'm not opposed to it, I'm not trying to say, look, delegates can go
I'm not
up there
taking a
and stay as
position
long
either
as
on
they
this.
want.
I'm not taking a position.
It
either.
just says to move forward. I mean,
I'm moving forward a citizen's request. That's all I'm doing.
yeah, that,
I'm not taking a motion on this.
yeah, I'm
All right,
the
then I'll
same.
vote for it.
Okay.
So to be clear, the commissioners are not taking a position. We're simply
Moving
agreeing to
forward a
forward the
request.
request forward to the delegation.
Yes, sir.
Thank you.
Well, I think the CSMC is not taking a position. I mean, I have my own personal position, which is I believe in term limits. So, you know, that's totally, just to be clear, so. But as a board, no position.
Okay.
Mr. Wyckoff, thank you very much for your
Thank you,
presentation.
commissioners, and
we'll move
see you
forward
next
with this
week on
next
it.
week. Very good. Thank you.
Commissioner President Guy, would you tally the vote, please? You had a first and a second on that one?
No, we had 5 yes.
Okay, thank you.
Yeah. Commissioner Hewitt changed his vote to yes.
Thank you.
We're just moving it forward.
Moving it forward. That's all we're doing.
Thank you.
Thank you very much. Well, now we move right into county administrator time. Dr. Bridget, it's all yours.
Thank you, Commissioner President Guy. First on your agenda are your draft agendas. So for next week on October 5th, you have 4 proclamations: National 4-H Week, Domestic Violence Awareness Month, Case Management Recognition Week, and National Disability Employee Awareness Month and ADA Awards. You also have a closed session scheduled for personnel. You adjourn and come back that evening at 5:30 for a public hearing with the Department of Land Use and Growth Management for the Comprehensive Water and Sewer Plan Amendment for Property on Tap LLC. And then you have your joint meeting of the Commissioners of St. Mary's County and the St. Mary's County Delegation at 6 p.m. that evening. You don't meet on October 12th, so the next draft agenda is October 19th. 4 proclamations are scheduled for that day: White Cane Day, Red Ribbon Week Young Marines, Red Ribbon Week Health Department, and the Economic Development Week. Also, you have your St. Mary's County Board of Health presentation that day. Also, the decision from the Office of the County Attorney's Office for the repeal of the solar moratorium ordinance. And then also scheduled is the decision for the public hearing from the Department of Land Use and Growth Management on the Comprehensive Water and Sewer Plan Amendment for the Property on Tap LLC. You do have a closed session scheduled for litigation on the 19th, and 6:30 p.m. is your regular quarterly public forum.
Thank you.
For today's business meeting, you begin with item B with the Department of Public Works and Transportation with the acceptance of the Defense Community Infrastructure Program, affectionately known as DCIP grant. Mr. Weiskopf, Director, presenting this morning. Good morning.
Good morning. Thank you, Dr. Bridget, and thank you, Commissioners.
Citron, yes.
Great pleasure to bring this before you. Ask for your approval for us to go ahead to accept the grant and move forward with the project. It's a project that's very important to the base as well as to the Great Mills, the Lexington Park Business District. The project was in the plan, the base intermodal study, as I mentioned when I came before you back in June to ask your acceptance of our June 22nd to actually apply for that grant. This will link Gate 1 to Gate 2 onto the Frank Knox Center with a sidewalk and create a crosswalk over from Gate 2 to the Lexington Park Business District and the Tulagi Square bus transfer station. It's a particular value to cyclists, of course. Gate 1 to Gate 2 is a mile in length, unless someone's out Gesundheit. There actually are pedestrians now that walk on the dirt and the grass. But this would greatly facilitate bicycle travel because Great Mills Road, as you undoubtedly can tell by driving on it, it's not conducive to bicycling at any skill level.
Mr. Dietrich, let me interrupt you for a second. When you're going to have bicycles riding on the sidewalk of Route 235?
Correct.
Why wouldn't they want to go on 235 where you have bicycle lanes?
There aren't any.
There's none on 235?
None.
There's no on 235 between Gate 1 and Gate 2.
Right.
Oh, okay, because I
Yeah.
thought, I'm sure I've seen them on 235,
Yeah,
but.
further north. The SHA did, when they designed that, they built in a right turn lane that causes, I think, huge problems. And there are pork chop islands at the corners that force people to turn right at the corners. They're also supposed to turn right into the various driveways that are along there, but they're not supposed to travel in that lane. People do. It's very dangerous traffic movements in that curb lane
Okay,
on
so we
that
don't see-
section at 235 as a result.
We don't see any problems with bicycles on sidewalks with potential pedestrians and bicycles. You don't see-
Now, there's so few pedestrians that this sidewalk of adequate width that we're going to produce will be perfectly safe for a cyclist to
Okay,
use.
that's good to know, because people reached out to me and said, Mike, it's a waste of money. But the key is it's more of a bicycle
It's more of a
lane
bicycle.
than it is a pedestrian sidewalk.
Correct. And the bicycle group at the base, Pax Velo, is very much in support of this. You've probably seen them
I get it now, I get it.
bicycling around.
It just didn't make sense if you're going to have people walking on the sidewalk and you get a bicycle coming along. But it
Yeah.
sounds like it's more a bicycle lane than a pedestrian lane.
It is, and the crosswalk is a really critical part. The sidewalk is a nice feature, but the crosswalk, and that's really where the bicyclists are going to come in.
I just need a clarifying question here. When we talked about this back in June, and I spoke up about this, one of the things we talked about was sidewalk from the parking lot behind Frank Knox along 235 to the pass office building there, so south of the intersection, but I don't see that specified out in the packet right now. So I want to be clear, because that to me is more valuable than the crosswalk or the other sidewalk. Having used that facility, the small parking lot right by Gate 2 isn't sufficient enough. The big parking lot, there's no way to get through that building if you don't have a pass. So having the sidewalk around that building is the critical thing to
Yeah,
me.
the connection is along 235 between the guardrail and the building.
So there will be sidewalks
Correct.
south of the intersection there.
Correct.
Okay.
Yeah, to try to get around the other side of Frank Knox, you're behind the gate, so we can't
Right,
use that.
exactly.
So,
All right, Mr. Dietrich, tell me, on these DCIP monies, it's something we apply for at a certain point each year?
If there's money in the appropriations bill.
Well, my point is, are you required to apply for it at a certain time of year, or is it available any time during the year?
there's a very narrow application window. They essentially give you a month to put it together.
Okay, so it is a window. My point to you is this would be excellent stuff for the YMCA in Lexington Park.
Right.
I know they're focusing in on their location, and we've had the A&E money. It sounds like this would be an ideal piece for that to come up next year whenever that window's open, so maybe if you can give us an idea when that window's open, we can be ready for it.
Okay, the key to this grant is you have to be able to break ground within 12 months of award, which means you need to have an environmental document done and really a full set of plans to be able to apply for it. So there may be some, if it can all be settled, then you would actually have an environmental document in place that says there's no negative impact to the environment, and you have a grading plan approved. Theoretically, you could get work started within a year of award. That would be the major challenges.
Okay, I hear you. But my point gets to be is knowing when that window is, that 1 month window is.
Right.
And knowing that can predicate some of this other stuff you're talking about. But I think seeing what they did in Fort Drum in New York with, millions of dollars put towards that YMCA, and the base is supportive of the facility, it just seems to be something we should be in tune to.
Yeah, I agree, and it should be considered as part of the planning. I think as Commissioner Morgan brought up, there was appropriation this year. We never know what's going to happen next year, but in some ways, perhaps all of these large projects like the YMCA should consider doing an environmental document as soon as they get a site selected, just to help grease the skids if there is any federal money available of any type. We had a great meeting last Thursday at the base with the CO, Captain Brabazon, and the colonel, the Army colonel that operates the program, Colonel Hogbom. And, he went through a whole list of various funding opportunities from the military. And then, of course, there's many others from other sources. But I just recommend that being part of any of these projects where we think we may be able to get federal funds.
All right. Again, knowing the window is important.
Absolutely. And I think the county now is on a pretty good information track to know when those things are happening.
Okay.
Yeah, Department of Economic Development really did a great job with tracking that, and also there's a consultant from the Navy Alliance that helped us in the kind of the absolute front end part when we were kind of stumbling along and needed to find our way. So yeah, I really appreciate Chris's effort, and then Destiny helped us put the application in, and it'll be transferred over to DPW when things move forward.
I will say I have concerns about this. I agree with Commissioner Colvin that the parking lot sidewalk to go from behind Frank Knox to Gate 1 is imperative.
Gate 2.
The crosswalk, even all the crosswalks you want, and as long as Gate 2 is the secondary entrance to the base, no one's going to be using that to go across the street to get to where. There's a question, it's like the crosswalk to where, and then simultaneously to discuss a bicycle lane on a sidewalk to go from Gate 2 to Gate 1. If you're on that base, which I am frequently, you're probably going to be using Gate 1 a lot more than Gate 2. And as long as Gate 2 remains the secondary base, and we've been discussing for years to make Gate 2 the main gate again, to make it a better thoroughfare to Lexington Park, this is a sidewalk for 20 people, a crosswalk for 10 people, but most importantly, it's a sidewalk for a whole bunch of people to get from Frank Knox parking lot to the gate, or the pass gate.
Yeah, it's part of the project. We actually, after the meeting on Thursday at the Knox Center, we walked out in the pouring rain just because the colonel wanted to actually see where this walk would go, and we kind of walked along there. We got soaking wet, but I mean, everybody, I think, fully appreciated the need for that to happen, because that small parking lot is, as you point out, it's just for the pass gate. It has nothing really to do with the Knox Center. So it's kind of attached, but it's not the same thing.
The Knox parking lot behind the old elementary school is the pass-through. When the pass office lot is full, you can park in the Knox and walk, as you clearly point out. That's the only thing that's really totally viable in this project, is to get from that back parking lot to the pass office. Not to think people are going to be using a crosswalk around Great Mills Road and 235, nor how many bicyclists are going to be coming out of Gate 2 to go up north to Gate 1 to get into the bicycle lane to drive home, when Gate 2 is only your tertiary.
So I guess what I would say too is, when we get started with this project, if you could prioritize that sidewalk first, that's key in my mind.
That'd be the perfect place for our groundbreaking within a year of the award. So Correct. Thanks.
Any more questions, Commissioner?
I move to approve the DoD DCIP grant agreement and amend project number HW2103 retrofit sidewalk program to include the DCIP grant of $395,118 and authorize its expenditure to construct a sidewalk on 3 Notch Road at NAS PAX Gate 2, Great Mills Road, and a connecting sidewalk from Gate 1 to Gate 2 and on to the Frank Knox Center to facilitate pedestrian bicycle travel between NAS PAX and various destinations in Lexington Park and St. Mary's County, and authorize the Commission President to approve budget amendment and/or other related documents.
Second.
We got a first and second, all in favor? Aye. Any opposed? Ayes have it.
Thank you very much.
Thank you, Commissioners. And item C is from the Office of the County Attorney for a briefing on House Bill 670 for the Police Accountability Board, Charging Board, and Trial Board brief. Dave Weiskopf, County Attorney, and Sheriff Tim Cameron presenting this morning. Good morning.
Good morning, everyone.
Good morning.
Again, it's still morning.
Morning, Commissioner.
Wanted to briefly discuss with you House Bill 670. As you recall, there were many police reform bills in last year's General Assembly, and House Bill 600 was a big one, and House Bill 670 was the other big one. We're going to talk about House Bill 670, and to give you, again, this is just a briefing, just a discussion to let you know what's coming. Obviously, it could change. This goes into effect in July of next year, so the legislature is meeting again. We will point out some questions we have concerning the bill. Hopefully, they'll address them, but it's possible they won't. We heard from, if you recall, Mike Sanderson was here from MACO some time ago, and his thought on this was it's an election year. They're not touching this again. So we'll see who's right, who's wrong. But to give you the bird's eye view, if you take anything away, is the Police Accountability Board, the Charging Committee, and Trial Board. Those are new things that we'll have to deal with. Next, please. And did you want to do an intro, Sheriff? Are you okay?
No.
Okay. I just, cut me off anytime, not a problem. So a broad overview of Maryland Police Accountability Act 670 makes certain changes to the Maryland Code. Number one, the big one, right, was that they repealed the Law Enforcement Officers' Bill of Rights. They've established provisions relating to statewide accountability and discipline process for police officers, altered some requirements for the Maryland Police Training and Standards Commission regarding training and police certification. They've increased civil liability limits applicable to police misconduct lawsuits. They require officers, when making traffic stops, absent exigent circumstances, to provide to the person stopped the officer's name, identification number, and law enforcement agency the officer works for. Require reporting on SWAT team activity and use of force complaints, and also establishes Maryland Loan Assistance Repayment Program for police officers and Maryland Police Officers Scholarship Program. And as we said, this takes effect July 1st of next year. And a broad overview is the Act establishes provisions that relate to statewide accountability and discipline process for police officers, including a Civilian Police Accountability Board, an Administrative Charging Committee, and a Trial Board. In addition, the law affirms the right of civilians to record interactions with police officers if the civilian is acting lawfully and safely.
I just had a quick question.
Oh, certainly.
I did see that. I'm sorry, because I know we're behind on time. How are they going to qualify the civilians? I mean, if a civilian is going to be someone who's going to make a recommendation about police conduct, how are they going to qualify that civilian?
There's a training program that has to be
Okay,
established
so
by the
they'll be
Maryland
able to-
Police Standards Commission.
Okay, all right, thank you.
There is going to be a little bit of, and we'll get to it, but the chairman of the Police Accountability Board is supposed to have relevant experience, which...
So it won't be police looking after police or overseeing police?
No, you're not allowed, again, to go back to the Police Accountability Board chairman, you're not allowed to be an active police officer, but you, again, as I say, you have to have relevant experience.
Can you be a former police officer?
I believe so, yes.
Okay.
So, thank you. Next slide. So under the amendment imposed by the Act, each county shall have to have a police accountability board that shall hold quarterly meetings with the heads of law enforcement agencies and work with law enforcement agencies and county governments to improve matters of policing, appoint civilian members to charging committees and trial boards, and receive complaints of police misconduct filed by members of the public, review outcomes of disciplinary matters considered by charging committees on a quarterly basis, and to annually submit a report by December 31st to the governing body of the county that identifies trends and disciplinary processes and makes recommendations on policy changes that would improve police accountability in St. Mary's County. And the amendments require a local governing body to establish the membership of the Police Accountability Board, establish a budget and staff, appoint a chair who must have relevant experience, and establish record-keeping procedures for the PAB. And as they tell us that an active police officer may not serve as a member of it, and that the membership of the PAB must, to the fullest extent practical, reflect the racial, gender, and cultural diversity of the county. So that's really all the guidance we get. Should it be 3 members? Should it be 5 members? Should it be 9, 12, 25? That's something that the commissioners will have to decide on. Do we pay them a stipend? Do we, and what's, what is cultural, we all know what racial and gender means, right? What does cultural diversity mean? I mean, that gets into age, gender, race, cultural, different groups.
I mean, will there be some more clarification on this?
No, it's free. It's basically, it gives you the ability to, try to come up with it on your own, so to speak. I mean, for example, the racial makeup of Maryland, I think, is about 50% white, 30% African American, 10% Hispanic, and 10% other, right? And men versus women, I think Maryland's one of those states that's 50-50 almost, or a slight, St. Mary's, I think, has like 400 more women than men,
Well, I guess for me, and I read this yesterday, It goes to like qualifications. I mean, how do you know these different groups are going to have the qualifications that are required or expected, I guess?
Well, I think what happens is, once the members are picked, they will have to undergo training by the Maryland
Police
Standards Commission.
Okay.
And so that'll happen, and then, so they'll
have to pass a course.
Yes. Just like our Planning Commission and Board of Appeals, right, have required training that they take on land use. Next slide, please. And then under the Act, complaints filed with the PAB will contain the following: the name of the officer accused of misconduct, a description of the facts underlying the complaint, the contact information for the complainant or the individual filing the complaint on or his or her behalf. They don't need to be notarized, and then the PAB must forward any complaint it receives to the law enforcement agency within 3 days following the PAB's receipt of the complaint. Now, the Administrative Charging Committee is made up of 5 members. They do tell us that, and they tell us exactly who it's going to be. It's going to be the chair from the PAB, or who the chair appoints out of his PAB group, 2 civilians selected by the PAB group, and 2 civilians selected by the Chief Executive Officer of the county. And again, the Charging Committee as well will have training by the Maryland Police Standards Commission. Now, the Charging Committee will be tasked with the following responsibilities: reviewing the findings of a law enforcement agency's investigation, determining whether a police officer subject to an investigation shall be administratively charged. If the officer is charged, recommend discipline in accordance with a law enforcement agency's disciplinary matrix, which is my understanding that they're trying to make that statewide, right? There's going to be a statewide disciplinary matrix.
There will be a statewide disciplinary matrix, and the Standards Commission is responsible for producing that.
Right. Because as it stands now, I think each agency probably are very similar, but each one has their own, and it's not mandated that it be uniform. They will review any body-worn camera footage that may be relevant to the complaint, authorize an officer who is called to appear before the Charging Committee to be accompanied by a representative, and issue a written opinion detailing its findings, determinations, and recommendations. Forward the written opinion to the chief of the law enforcement agency, the officer, and the complainants. And in addition, they've obviously got to keep it confidential until final disposition of the matter. They may request information or action from the law enforcement agency that conducted the investigation, including additional investigation and the power to issue subpoenas. If an officer is not administratively charged, they can make a determination that the allegations are unfounded or that the officer is exonerated, and they can also record in writing any failure of supervision that caused or contributed to the officer's misconduct. And again, as we said, the Maryland Police Training Commission is required to develop and adopt a model uniform disciplinary matrix, and then each law enforcement agency will be required to adopt that. And then with getting back to what the charging committee does, when they issue an administrative charge against an officer, the chief of the law enforcement agency shall offer discipline to the police officer in accordance with the disciplinary matrix.
Well, you know what we've seen, though, is that it takes so long for a case to get, like an autopsy to come back or different things to come back. I mean, I know friends who have issues with something going on right now, and the point gets to be is, what makes 15 days? Or will there be a timeline that this has to be figured out? I mean, will it be 30 days, 180 days, a year?
Right. I'm not sure. Sheriff, do you think this is going to add time or detract time?
It absolutely will add time.
Right.
This has created a new bureaucracy, and there is no clarification coming unless it comes from the legislature. So if a case rises to the necessity of going to the charging board or charging committee, they prefer charges and an officer selects a hearing board. The difficulty always in putting a hearing board together was matching the schedule of the attorneys representing both parties, the attorney representing the agency and the attorney representing the officer. That was typically the holdup, is trying to match those calendars. But 3 to 5 months was pretty typical. I couldn't tell you what I would estimate this to be because it's a new system.
Well, I think that's a frustration of constituents as to how long it takes. Is, hey, it seems to be cut and dry, but everything's not cut and dry. So the point gets to be is, will they figure that out, or will it just be something that drags on forever?
No, I think this system, again, it's a new bureaucracy. I think it's just going to take much longer than the previous Bill of Rights did to get an officer to a trial board. And please don't mistake, this is administrative, not criminal.
Okay, I am confusing the two, but again, it gets to be, how long does it take to get something adjudicated?
The important point for the public is that people are held accountable. Whatever that time frame is the end result is people were held accountable and the public was kept, or the victims or the complainants were kept informed.
Okay.
The old system did that, as does this new system. But again, it's a new system proposed here. Well, it's not proposed, it's codified. It's July 1, 2022, it's coming.
If an officer is disciplined, will that be public information, or will it still be?
Disciplinary files under another bill are now, yes, open to the public. They're not considered to be part of a personnel record.
Okay.
Today, and that.
Right, that's another new.
Whether litigation evolves over the next months, I don't know.
So Sheriff Cameron, when this was enacted in the last legislative session, was the law enforcement as a whole behind this? Or were you opposed to this? Or was this something that the legislature decided to do and sort of overrun you?
I totally opposed it. The sheriffs statewide opposed it. The chiefs opposed it. And not because we're against police reform. Absolutely not. Exactly opposite. We all are committed to reform. But we didn't feel this was real police reform. The Police Bill of Rights, for what it was not really a Bill of Rights. It was a codified due process for police discipline and police conduct, how complaints are made, received, what the officers can expect as they go through the administrative investigative process. I think the name was what created a problem, the Bill of Rights. Like, we have actually more rights than the average citizen. In fact, we have less. No American citizen can be compelled to answer questions in an interrogation, period. But yet an officer is subjected to that.
So the OBR is thrown out, this is put in, and for the most part, as you point out, the law enforcement community was opposed to this, but it was overruled by The legislature.
Legislature, yes. And,
Thank you.
and we wanted to go to the table, I think, with the work group. I think the chief, the president of the Chiefs Association, the president of the Sheriff's Association, and the Standards Commission director met with them one time. There was little other interchange with any of the members of the work group on this. We had recommended prior changes to the Law Enforcement Officer Bill of Rights, many that are contained herein that weren't acted upon. The few changes to what we refer to as LEOBR made by the legislature did in fact include the possibility of citizens sitting on a hearing board. In fact, the board remembers, I think it came through the commissioners, my request to be able to have citizens on the board to enact local legislation, which, you know, was academic after this was passed. I mean, it was my desire to have that level of transparency. So anyway, I mean, this is what we're going to work with now, moving forward.
Thank you. And next slide, please. And so to continue about the discipline under the disciplinary matrix, the chief of a law enforcement agency may offer the discipline recommended by the charging committee or a higher degree of discipline, but cannot go below that that's recommended by the charging committee. And if the officer accepts it, then that discipline's imposed. If they do not, it gets referred to a trial board. And at least 30 days before a trial board proceeding begins, the police officer must be provided a copy of the record, notified of the charges against him or her, and notified of the disciplinary action recommended. Trial boards generally, and while the police and the sheriff has had that in the past, we've got some changes that have been made. So we have to establish a trial board process, and we're permitted to use the trial board process of another jurisdiction by mutual agreement. Next slide, please. And what's new is an actively serving or retired administrative law judge or retired district or circuit court judge who is appointed by the chief executive officer of the county be part of the trial board now. A civilian who's not a member of the charging committee who is appointed by the county's PAB, and an officer equal in rank to the officer accused of misconduct who will be appointed by the head of the law enforcement agency. And again, before serving on the trial board, you all have to, the members have to be receive training from the MPTSC. And the trial board proceeding and powers, you know, they're public unless exclusion is necessary to protect a victim's identity, personal privacy, child witness, medical records, confidential source, investigative technique or procedure, or the life or physical safety of an individual. And the trial board is permitted to administer oaths and issue subpoenas necessary to complete its work. And just, you know, I've been here, going on 14 years, and I think there's been maybe 2 trial boards that I've been aware of. There hasn't been many. And generally, the burden of proof in a proceeding before a trial board is a preponderance of the evidence. A police officer obviously may only be disciplined for cause. And then within 30 days after the trial board issues its decision, the police officer may appeal it to circuit court. An appeal obviously is on the record, and any decision that's not appealed is final. And if number 17 and number 18 are the same. If we could go to number 18, it's a little bit easier to see. This would be the sample complaint procedure. A complaint of officer misconduct would be submitted by a civilian. That's logged in by the Police Accountability Board. The complaint gets sent to the agency within 3 days of receipt for investigation. The investigation files are sent from the agency to the charging committee. The charging committee reviews investigative findings, and then they decide whether to charge the officer. And as you can see, if not charged, they can make determinations that it's unfounded or exonerated and may note failures of supervision. If charged and discipline is accepted, that's the end. If it's refused, then it goes to the trial board. They hold a hearing. They issue their decision, which then can be appealed to circuit court. The appointment to boards. The local governing body establishes members to the Police Accountability Board, appoints members to the Charging Committee, and appoints members to the Trial Board. The Police Accountability Board appoints members to the Charging Committee and appoints members to the Trial Board. and the law enforcement agency establishes and appoints members to the trial board. And just to give commissioners fair warning notice, this is where the sheriff and I, or the sheriff and the legislature, disagree about who gets to appoint members of the Police Accountability Board, right, over what's termed as the local governing body. The sheriff, you know, Maryland sheriffs are unique in history, right? They were, they were agents of the crown way back before the, Declaration of Independence. And then when that came along, they were democratically elected. And they have, preserved in our Constitution, they have certain constitutional duties. But they've got a foot in both worlds, right? Ancient and modern. They've got a foot in the executive place. They've got a foot in judicial, so they're very unique. And the sheriff, I think, not to put words in his mouth, because he's certainly right here beside me, believes that as a constitutional argument, constitutional officer, it's not the commissioner's place to, oversee him.
Yeah, if I could with that, I would just point out a couple things. This is complex. Make no mistake about this, and we're going to muddle our way through this over the next several years. The legislature, I'm sure, is likely to come back to address some of these things, probably not this year because of the election year. But this bill does mention the term superior governmental authority, which they define as the governing body that oversees a law enforcement agency. That is not this board's role. I am the governing body of the sheriff's office. And that is one of the things I noted, not one time in this bill is the term sheriff ever used. This was written for a county with a county police department, right? So in our county, this would not include the DNR, the state police, because they're statewide or by county is how it enumerates that. It would be any county or municipality with a police force. So for us, it's quite simple. It's a sheriff's office. Again, I think that's very clear. The superior governmental authority that oversees the sheriff's office is me. Make no mistake, this bill, in my opinion, encroaches upon the separately elected constitutional office of sheriff, as well as the state's attorney, in my opinion. The people of St. Mary's County, as they elected you, with certain expectations, and that is that I would manage the office and the personnel in the office, hire good people, train them, and hold them accountable. But it now limits my ability to discipline my officers. It tells me that I can go more than, but I can't go less than. That is a limitation. So my purpose of being here today is saying this is what we have to work with. I believe that the way the bill is written, it comes under my scope of authority to make these appointments, enact these things, and move this forward. Will that change in the future? Yes, it could. The legislature could come back, even though we urge them to acknowledge the fact that a sheriff is not a chief. A chief is appointed. A sheriff is elected by the people, and consequently, that is our boss. They have direct access to the sheriff. And that's why right now there's so much conversation about the constitutional nature of the sheriff being able to repel certain things from the federal and state governments. But I certainly think this is the beginning on the attack on the office of the sheriff. I've been told that I'm giving the legislature a lot of credit, but I am. I don't think this is coincidental that they do not mention sheriff or deputy sheriff one time, not once. The other thing I would point out to the board, it's a great presentation by Mr. Weiskopf, but there are things that are required in this bill, and they're new positions. They're unfunded mandates, make no mistake. There's a requirement for a victim witness advocate who has to establish a database and provide certain information to people that are complainants or victims of police misconduct. It will require somebody to handle the myriad of PIA, Freedom of Information requests. This chair of this Police Accountability Board and Administrative Charging Committee, we're not going to be able to do that with a volunteer. It's going to take a full-time employee, and they're going to need admin support. So those are the things those are part of these bills that we often see that are absolutely unfunded mandates, and this is no different.
Sheriff, I totally agree with you. You have your own constituency, and if people don't like the job you're doing, they can have the ability to change that. But tell me, Mr. Weiskopf, are the sheriffs elected in every single county? Like, is the same rules in code home rule or charter or commissioner? Is it the same everywhere?
There are sheriffs, I believe, in every county. However, their duties in every county is different, right? Prince George's County, the sheriff's duty there is just limited to their constitutional duties of overseeing the local jail, doing subpoenas, providing court security.
Are they all elected officials, though?
Oh, certainly, yes. Yes, all sheriffs are elected.
Everywhere in the United States, the sheriff in every county, every jurisdiction is elected minus one. There's one jurisdiction in the United States now that it's appointed.
Well, I guess my point gets to be is this. The local governing board needs to be clarified. I mean, I don't expect it to be me. I don't have the expertise you have. But my point gets to be is that needs to be clarified. So you don't see that happening anytime soon?
Well, I mean, quite simply, I would have thought this would have been clarified in the bill, but that's a totally another argument. I mean, what you get into is the question of legislative intent.
Yes.
And so where it's not clear or plain, you get into determining what the legislative intent was. And that's done through litigation. Quite frankly, the court determines that.
Oh, good point.
Or the legislature comes back and they refine it. Again, I've heard from a number of people saying that they don't see that happening this year because of the election year, to go back in to make changes in the police reform bills.
Good point, though. Courts is where it'll be determined.
Yes, that's where you get legislative intent comes from. I mean, the courts determine the intent.
And and to be fair, I see the sheriff's side. The bill, I guess the lawyer side would say that the bill says, local governing body, and that's defined, in other places that says it's, the county commissioners and commissioner counties, it's the county executive and charter counties, and so it's just a difference of opinion that we're allowed to have. And but could this bill have been written better? Absolutely. And will there be parts of it litigated in courts? If not this, certainly probably House Bill 600, right? And so again, this is no decision today. It was just letting the commissioners know that this is coming. And we're researching whether or not, what we think will be needed in terms of FTEs or no FTEs, what will be needed in terms of, trying to get together and decide, how many members PAB should have. These are things that obviously we're going to come back to you, sometime before July and try to iron out. And in a perfect world, this will be answered between January and April 15th, right? We will get the answers to those, but
we can't. I mean, the hope is not my strategy ever.
Right.
Quite frankly, I have to be ready July 1 to move forward with whatever it is, and we know it's this in one form or another. But I feel the way that the law is written, it's clearly in this case it is me. And I do know that we have tried to change our government here resoundingly. Our citizens have rebuked that, and one of their arguments were they did not want changes to their office of sheriff. I hear, as you do, every day from our constituents. And again, right now, there is a lot of talk over the constitutional nature of the sheriff, the separateness, and our state's attorney. Again, I believe that these bills, not just this one, but several others, imping upon the constitutional separateness of those elected offices.
I like your response of hope is not a strategy.
Yes, never is.
No, I agree with that.
Well, the future is created by those who plan for it, right? I believe Malcolm X said.
But did either one of you see any kind of change in this session on this? Probably not because of election
We'll
year.
see. I mean, we're going to reach out to MACO and let our thoughts be known that there needs to be some changes. We'll reach out to the Attorney General and see what their thoughts are.
Right.
Well, we have a meeting with our delegation next week. We can ask them what their intent was, right?
My guess is
I'm not sure that'll help.
my guess is our delegation probably was on the minority side for the most part, right?
But say that it'd be a worthwhile question to
And
ask
not
our
all.
delegation how they voted the last time for this bill.
Did he vote for the bill or against it?
I think we should let our delegation answer that one.
Probably had one that
Ask them, let them answer the question on TV.
But that, Commissioners, that really was our briefing today, just to, put it on your radar, so to speak, and thanks for indulging us with
So
the
the main
time.
thing we got to determine, and of course, you're right, Sheriff, you're the body who's going to appoint these people.
Yep.
I suppose you better start get to work on
Well,
it.
so nonetheless, I mean, we're going to continue to forge ahead. And,
Right.
To try to be ready July 1. We have some other things
Yeah, we have to.
that have changed as well as a result of this bill and other bills coming.
We can't hope for change, we just got to keep, this is what we got to work with right now.
Yeah.
Yeah.
Yeah. Thank you all very much for your time. Appreciate
Thank
it.
you very much, sir. Thank you all very much.
Thanks, Sheriff.
Thank you.
Next, we have
Thank
the
you.
county attorney again, right? You got it.
Yes, we
You got
do.
it.
You're absolutely right, Commissioner Guy. The Office of the County Attorney has a real property request for the Windsor-Amundsum request, the agreement for the lateral line setback. Mr. Weiskopf's presenting again this morning.
Thank you. This one, real simply, Commissioners, was brought to our attention by two neighbors that wish to rebuild and improve upon their piers. As you know, in many waterfront communities, the lots are very, in the old ones, the lots were very narrow. We have something in our zoning ordinance that says that you can't build within 25 feet of the lateral line of your neighbor when you construct a pier. And that's, hopefully to keep the peace and not have people's piers on top of each other. But because of these small lots, land use and growth management has actually created a form where people can encroach on their neighbor's property, 25-foot, lateral line setback, if the neighbor agrees. And this interesting case is from a neighborhood in Piney Point that when it was developed, I believe in the 50s, they actually deeded the street to St. Mary's County. Normally we just see it drawn on a plat and they're like, yeah, you guys can have it. And sometimes it's a paper road, sometimes it's not. This one was actually deeded to us. So we actually own the road all the way to the water. And it's very narrow, so we couldn't really use it for anything else like a landing or something like that. As you can tell from the aerial picture, people have been, storing stuff on it and parking cars on it probably since time immemorial. So the two neighbors, whose names are Windsor and Amundsen, have asked the county, since we own this property in between them, and the best thing is to show, if you go to the GIS picture, I tried to show where they own the property, and you can see the county owns that little piece in between. And what they're asking the county for is to sign the lateral line setback, amendment to allow them to build. Again, they could rebuild their piers by right, but I think they want to make some improvements on them. And once they go beyond the initial footprint of their pier, they would be within 25 feet of ours. But in speaking with a gentleman who's building the piers for them, a Mr. Kimball, they're actually going to, be moved a little bit away from our property, but still, as you can tell from how narrow it is, they'd still be within 25 feet.
Looks like they've already encroached.
Oh, yes. I mean, the one almost looks like it's on
right on
county
the property
property.
line, yeah.
But
So, I mean,
But
yeah.
this is what the law is, so it's just
But
them.
this piece of land we own is just the end of a street.
Yes.
It's really not a usable piece of land at all.
No, I couldn't see any, if, maybe the neighborhood uses it to launch a canoe or a kayak, they'd still be able to do that, right?
Yeah.
It's just,
On the Board of Appeals back in 05, 06 or something, and one of these places, one of these piece of properties in this creek, had actually, the fellow had extended his pier way out so he could get what he called water deep enough for his boat.
Right.
And that pier was like 400 feet. Now, that Board of Appeals made him take down probably 250 of it. Point is we're not going to open up any can of worms by doing this.
I don't believe so. I don't know how many properties the county owns that are, we'd be in this situation. There could be another street in this development, that might be the same thing, but it's not a can of worms that I would see with any
It's a
regular.
case-by-case basis.
Oh, absolutely. Yeah, we're not setting any precedent or something like that, because
We're not changing any laws or anything.
no, we're just being a good neighbor.
All right, well, I move to approve 2 agreements for structure to cross 25-foot lateral line setback between the county and the Windsors and the M. & Sons, and authorize Commissioner President to execute all related documents.
Second.
Yeah, I got a first and second. All in favor? Aye. Any opposed? Ayes have it. Thank you, Mr.
Thank you,
Weistrop.
Commissioners, and this completes County Administrator time.
Thank you, Commissioners.
Okay. Let's go right into Commissioner time, and we'll start with Commissioner Morgan this time.
Thank you, Mr. President. County Fair last weekend, it was great. Got a little damp on Wednesday night with setup, but the attendance seemed to be really good all the days. I think everybody seemed to have a really, really good time. Now, leading into Dr. Brewster's speech and her discussion on the COVID, I'm sure that there was a lot of transmission going on there. I think that some people were mindful and being careful. Can't say that for everybody, so I would just encourage, as she said, get your shots. With that, I hope you all had a good fair. Thank you.
Oh, what can I say? The fair was great. It was great to be out, great to see people. I would tell you the fair parade was fun, and for those of us that got a chance to participate, it was very well attended. The fact is, the fair being outside is one of the amazing events that you can attend, and like Commissioner Morgan said, there's people doing what people do. And hopefully people are taking whatever precautions they need to take as necessary from there. There was some concern about the farmers market in the north end of the county. Emails to our great Senator Bailey and Delegate Matt Morgan, and one to me, and then a false Facebook post about what's going on up there. So fix that. Made sure that got out there, but Chris Castellanos Economic Development's doing a great job. Yes, the farmers market is moving. It is not going away. Nobody's being evicted. The county had a great project, put it together. The rental fee is actually lower than what is being paid right now on the county, and it's secure county property, and it's securable. It's a nice facility. There's been a lot of buy-in, and of course you're going to have those with any move or situation that just don't want to go. So what I would suggest is, prior to just taking the word of mouth when you're at the farmers market, if you have a question, you can reach out to our economic development department. They can get some great clarifications to you. And I think that taking a drive down the road and seeing the amazing facility that's going to be there, I mean, every year the revenues continue to go up, $1 million in revenue, and I think that's going to go up. We get the meat processing facility. It's going to be a nice place to go. And it'll be moved right off that corner. It'll be a lot safer as well. So I appreciate that, and I appreciate economic development, getting behind it and getting so many answers out there quick. Thank you.
All right, so last week, Commissioner O'Connor and I attended the 7th District Optimus installation for their new officers. So I just want to offer congratulations to Mike Copel and all the new officers in the 7th District Optimus Club. They do some great work. He had an excellent speech about just the need for volunteerism in these civic organizations, and it's very true. And related to that, coming up this weekend is the Blessing of the Fleet. If you haven't ever been to the Blessing of the Fleet, maybe you heard our presentation from Dr. Brewster today about the high rates of COVID transmission. If you're going to do events, be outside at least. It's safer. It's going to be a beautiful weekend, and go out to St. Clements Island and see just the wonderful stuff going on there. It's going to be a great weekend down there. So check that out if you can. County Fair was just wonderful. It was great to be back at the fair. It was a lot of fun. I was there for a couple days, and parade's always a good time. And just there's so many people behind the scenes making it work. Thank you to all of you. And then if you drove by the fair, even if you didn't attend but drove by the fair, you saw the flags. They had flags everywhere, and it looked really great. And there's a fun story behind that. Those flags were donated by an individual to the fair, and he used to use those flags for the Marine Corps Marathon, and now the fair owns them and is using them. So it was a really good time. They're improving every year, and this year was a great year for the fair. Finally, I want to conclude this week, the last week of September. It doesn't mean anything specifically to most people, but to a large group of people in our county and around the country, it's the end of the government's fiscal year. So Commissioner Morgan, you've dealt with this, I'm sure, plenty. Every year, I joke, it can't get any worse than this, and every year it does. And just the end of a government fiscal year is crazy for the people who I work with and everyone involved just around the world, really, not just in our county and in our country. That we've got bases all over the place, and sometimes those bases over in Germany and stuff, they're a few hours ahead of us, so their fiscal year ends a little bit earlier. It's complicated, it's difficult. But there's a couple takeaways too. Along with the end of the fiscal year, there's a threat that the federal government's going to shut down. County government always passes a budget. We continue to operate, we don't shut down. So we don't have that luxury that the federal government does of just making up rules as they go along. But every year it gets more complicated, every year it gets more difficult, so my hat's off to all the people who are out there working crazy hours this last week and finishing up the fiscal year. Hope you have a great end of the year and see you next year. That's a joke we always make. Thanks.
Mike, you got it.
County Fair, I want to say it was a great time, very well attended, enjoyed it very much, attended 3 of the 4 days. One thing I will say, though, is when at the Ridge Carnival a week earlier, my grandchildren took them down there, and they were able to get on a ride about every 2 to 3 minutes. Took them to the county fair, they waited in line for an hour. I mean, it's great to have that wristband, but it's kind of a disservice for people waiting in the sun, and thank God it wasn't hot. It was cooler and a little breezy, but an hour to get on a line when you're standing in line with a 4-year-old or a couple of 4-year-olds and a 9-year-old is a long time. So maybe we can help out with that. But John Richards, you did a great job. You and your 17 directors, love seeing them all in their light blue shirts. Easy to find them. Great people, great thing. Thank God St. Mary's County is back with their county fair. Chamber State of the County last week, what we went to after our meeting. That was another great event, well attended. On a dour note, though, the county lost 3 people this past week that I need to recognize or mention. First one was a woman named Patty Runco. Her husband, Ray Runco, and her, people came here with the military. They came here with the Navy, same time as my dad did, early 60s. And I always remember Ray when he wanted to get into real estate. And Patty was an entrepreneur. She had this business called Famous French Galleries. It was down there next to the Plaza Theater in Lexington Park. We're currently the Lexington Park Post Office. That's prior to a lot of people's time, probably a couple people on this board for sure. But the point is that she was an entrepreneur. She bought an ad for me for the Great Mills High School class in 1971 yearbook, and boy, she was a tough sell. But I got my $15 and she got her quarter page, and I always respected her as a sound business person. But what she really had a talent for was art, and she was an accomplished artist. And attending her services the other day was it was very heartwarming. All the people were there, and people had said nice things about her. Secondly, I'm a member of fraternal organizations, and the Fraternal Order of the Elks. We've been in the county since 1958, a little over 63 years. Their last charter member, Howard Britton, lived in Valley Lee, right down there next to Tall Timbers. He passed away at the age of 91 this past week. Great guy. Attended his funeral and whatnot last night, the viewing. Today's the wake. Howard, rest in peace. Great guy. And lastly, on a very tragic note, a friend and neighbor of mine and member of the Moose Lodge lost their 3-year-old daughter this week to a drowning accident. Terrible, terrible event. The Patuxent Moose Lodge in Hollywood is holding a benefit spaghetti dinner for them today. 100% of the proceeds will go to defray the cost of the burial and just other tragic costs that are involved in a funeral. And that's from 4 to 8 p.m. And if you have the time or you just want to drop by, they'll take Venmo, you can go online to the Patuxent Moose Lodge website and donate. It's just a terrible tragedy, and I'm sorry to have to report that, but thank you.
Thank you, Mike. Thank you, Commissioners. I'm going to implore everybody who has not been vaccinated, please get your shots. It will help the community, it will help our county, it will help the country to get this pandemic behind us. And I think you need to really look seriously about can you take this or not. And I'm looking forward to getting my booster shot soon. So I say do it. This Saturday and Sunday, that has been already talked about, Blessing of the Fleet. For those who don't remember that, years ago, the Blessing of the Fleet was the work boats in our area, the oyster, the clammers, the crabbers. It was a blessing of their boats, so they have a successful year coming up and have no various accidents and whatever. But we also accept pleasure boats to come out and get a little blessing. And Sunday will be a parade. Well, hopefully we'll all be there for that. And so please come out and enjoy their activities there. Also, the same thing, there's another powerboat regatta, I think down at Piney Point. What used to be Swan's Piers down there by the bridge that goes across St. George's Island. They're going to be on demonstrating their, you might say, vintage race boats that were out here in the 70s and 80s. Some of them reaching speeds of over 100 miles an hour. So it'd be something to see for those who want to. We got a lot of water activities going on this weekend, so try to do that. Also, I understand the federal government budget ending. I've spent my last 4 years at the Pentagon and it was always the last week or two prior running around getting letters to send to people for their possible stay at home and all that kind of stuff. It was unbelievable what it costs the government every year, especially I know the military, not so much active duty, but all of these people that work for the federal government, what they went through to process because unfortunately our delegation, I should say the House and Senate can't pass a budget and it's last minute type of thing. So it's just a terrible mess we get into every year. With that being said, we will end today's journey and hopefully come out this weekend and enjoy the Blessing of the Fleet.